Are you there? I think I should be there. Shabana? No, not yet. Shabana is not there. Yeah, one more student. So only Shabana. We are missing Shabana. Okay. I want to hear from you the feedback because you're going to be with me for another like 3 more weeks, I believe. So is there anything that you don't understand that I have to make you understand, or it's okay for you? Because we are
Miss,
going to, yes.
I do have a question. When I was reviewing one of the slides yesterday, because unfortunately I couldn't listen to the entirety of it
Yeah,
because
yeah.
I had to go to the appointment, right?
Yeah.
But I was going over yesterday's slide, specimen integrity, right?
Uh-huh.
And on slide 15, it
Uh-huh.
mentions that short draw plasma tubes are typically fine to use. However, in the tubes that they say, like in the example that's in brackets, it mentions serum tube. It mentions serum tubes.
Mm.
So my question to you is, which tubes are okay to use with a short draw? Because the ones that they mention here are serum separator tube and
Mm-hmm.
the serum tube,
Mm.
even though it mentions plasma tube
Mm.
in the PowerPoint. So my question to you is, which
Mm.
one's right then?
Plasma separation tube should be given importance for the short draw because there is no specific additive to destroy the RBC or cellular components in SST. In SST, we have the clot activating factor anyways. Instead of taking a big tube and then drawing more blood, depending on the test that has been listed out, SST won't be a problem. Yes, for PST, it is a problem. So the suggestion is for PST, you have to be very specific about if it's a short draw, use small
Okay.
tubes.
And then for SST and red tops are typically fine, like as long as it's not a super short draw.
Yeah, we have two sizes. We have a short size ones, bigger ones. That's the bigger ones, 10 ml, 6 ml is available.
Okay.
And the 4 ml is the shortest one. So better when you see the requisition as a trained technician, you will get an idea the number of tests that's been ordered and how many ml of blood or how much ml of blood has to be drawn. So based on that, you make a decision.
Okay, perfect. Thank you.
Yeah. Did I answer your question, Santiago?
Yeah, you cleared it up. Thank you.
Yeah. But the confusion is with the PST because in PST, the ratio, like it doesn't matter if it's for 3 tests or 4 tests. If the ratio is of, the ratio of the anticoagulant to the blood is not sufficient up to the limit that's been expected, then the hemolysis is the possibility and the test results will not be accurate. Is it clear?
Yeah, it's clear.
Do you want the 10 ml or 6 ml to be filled or not? Depending on the test, you have to draw because we don't want to waste the blood anyways. So for 2 tests, you don't have to fill the 6 ml or 10 ml of the blood tube. It's a waste. So just take the 4 ml tube and then do the job. If 10 to 12 tests are ordered, then it's okay to use the bigger tube. And the mixing ratio also will yield a good result. For small draws, we don't have to waste the bigger tubes. Clear? Santiago?
Yes, sorry. I was just
No
helping my little
problem, ma'am.
brother out with something. Yeah, yes, Miss.
Is Shabana going to be here? 2 more students. Shabana and who?
Miss,
Yes.
Asnet was just online, but she just contacted me
Okay.
that she's having, laptop
Yeah.
issues, so she's gonna
Yeah.
be with us soon.
Okay, no problem.
Yeah. Okay.
So we'll start now. Okay. What do you understand by the specimen integrity? Quick question time. I told you I'll be asking more questions. So
Quality of the specimen.
quantity of the
specimen.
quality. Yes, very good. Not the quantity, but the quality of the specimen. Very good. Good job. So we are looking for the quality. So we're giving the quality assurance here with the test results. Good job. Now, this table is very important. The contents of the table is very important because based on this, you will always get questions. So even for the test point of view that you're going to do it on Friday, this Friday, I think this table has more information to deliver. So be prepared with this. That's why I gave this as a worksheet for you as a homework. I believe everyone has gone through this. They have prepared. First, let us review with this. I'm going to ask question. Will you accept the unlabeled sample? Who's going to
No.
answer my question? Christiana? No.
No.
Majority of the time, not majority of the time. It's not a relevant test or test result that you're going to get because you don't know who the patient is. So whose result is going to be there, we don't know. So no is the answer. If in case it's a hospital, as we have seen in one slide, the labels are in the bag, the requisition is there, and the name is matching, but still the labels are not on top of the tube. What is the other option that you can do?
In the hospital, if it's been like an invasive collection or a difficult collection, like cord blood, you would contact the physician to have them physically come in to identify the samples and label them.
Very good. So what is the added thing that you are supposed to do? Just put the labels and go? There's
Like,
one more.
No, the doctor would have to.
Doctor will do that.
Document. Yeah, document. There's a documentation that we have to write.
The waiver form is important.
Exactly.
There's a waiver form that says, okay, whatever the test result is, it's my responsibility. It's not your job. So you have done your job and it's not your problem. That's what it
Yes, I
indicates.
miss a lot. Sorry, my computer went down. So
Yeah,
I missed so much.
Yeah, that's okay. Now, unspun sample. If the sample has to be spun within the 2-hour time period, if it is left, what will you do?
We spun it, ma'am.
Yeah.
And deliver it if it's within the 2-hour period.
Very good.
Deliver to the department.
Yeah. If it is left, then you check the time limit.
Yes.
Then if it
That's
is
right.
within 2 hours or close to 2 hours, then you have to do within the acceptable time limits, you have to do the centrifugation and then you deliver it to the departments. Okay?
Yes.
And if it is over the 2-hour mark?
Then you have to cancel it and then you have to recollect.
So if it is plasma or serum that is needed, then that will apply. But if it is not, then you don't need to discard it or not accept it. If it is whole blood that is needed, then you just accept it.
Yes. Because whole blood has nothing to do. You put it in once again, the mixer. There's a mixer in the lab. I'll show it to you. It'll just again mix the whole components and then you're going to test 4 of them. What are they? 4 tests.
Packed red blood cell. What else?
Packed red blood cell. ESR.
Blood grouping.
Blood grouping.
PCV and ESR.
PCV is the packed cell volume. Okay, again and again, packed cell volume. ESR, I'm listening. One person said blood grouping, hemoglobin.
ESR, hemoglobin, yeah.
Okay, very good.
Sorry, can someone get Shabana in? She's unable to get in, please. Can someone get her in?
Yes, can someone say, okay, I'll try to. 1 second. Is she here? Shabana, hello, good morning. Yeah, she's in. Hello, Shabana.
Hi, good morning.
Hi,
Sorry,
good
I couldn't join
morning.
the
Join,
meeting
no
for some reason.
problem. No problem. So, very pale serum or plasma, you're looking at it. What is your decision? What's the conclusion when it's a very pale serum up? I want everyone to answer. Yes, now, Zarina Main, can you just pick this? If there is a very pale serum or plasma, what will you do?
Morning, sorry, I was just in the washroom. Sorry, can you repeat again the question?
Very pale serum or plasma?
Sorry, there was nothing to repeat. Very pale serum.
What is your conclusion? What will you do?
I think when you have very pale serum,
What is the reason? What could be the reason? What comes to your mind?
Contamination.
Sorry, I can't.
Who is willing to give the answer?
There's a probability of IV contamination.
IV contamination, very good. Then IV contamination. So can you run the sample?
No, you have to aliquot it and then we spin it.
Aliquot spinning. Before that, what is the original thing that you have to? What's the real thing that you have to do as a technician?
It's a confirmed patient.
Confirm the patient, whether the patient see the document. What has been documented? That's why we document all the time. If the document says the blood collected was an IV patient, then it's clear that there is a contamination, right? And then now you have to inform the MLT. The MLT will check with the previous collections. They will compare, and then they will make a decision. They will tell you what to do. You have to collect it again after 2 hours, or sometimes they will, if it's so urgent to see the blood results, then they will stop the IV for 10 more minutes, and then they will insist you to take it again within the short period. Okay.
Also, I also have a question. Mostly of the reviews I read, when you have a patient that has an IV, can you also get on the other hand?
Yes, the first preference is the other hand, the other option.
Okay.
If there is no option, then try with the IV hand, the IV vein. But the thing is, you have to shut down the IV.
Only
and
for
then
2 minutes?
Yes, 2 minutes. It says 2 minutes theoretically, but I wouldn't agree. At least a minimum of 10 to 12 minutes or 15 minutes should be there. Because even in the exam, when the exam that I wrote like a few years back, it had the option starting from 12 minutes, 30 minutes, and something like that. So I wouldn't agree with the 2 minutes based on what I have said. The book says that, some book says like 10 to 12, 15 minutes. So if it is in the theory for you 2 minutes, if 2 minutes is given, pick the answer, or else I would say in the real practical thing, 2 minutes is not enough.
Okay, thank you.
10 minutes, you shut down for 10 to 12 minutes, and then you use the discard tube to discard the thing, the first blood, because definitely there'll be a contamination. Then you will take the blood. Clear?
Yes, thank you.
Most welcome. So
Yes,
anticoagulant tube, because I was looking for the
Yes.
answer to the option 2 minutes. Option 2 minutes was not there. So the closest I picked was 12 minutes or something. That's fine. So I decided this is the nearest number that I can pick, and then I picked. Right?
Ma'am?
Yes.
Ma'am, there is a message from Dr. Moon Moon.
Yes.
And I want to send a link.
For what?
I don't know.
1 second, let me check. Okay.
Send me a link, please. That's what she said.
Oh, she said to. I never got it. 1 second. Okay, we'll proceed with the questions. I think she wants to join.
Yeah, WhatsApp in WhatsApp, ma'am. Thank you.
You're most welcome.
Miss,
Yes.
I have a question.
Yes,
please.
go ahead.
What if the IV is in both hands? Then what do you do?
I told you, if they're depending on like what they have to make the decision, they will take by closing like which one is convenient, like which one is like the palpable vein. Otherwise, if there is a possibility of going with the capillary puncture, they will go with it. So there are different options that they have to decide and do. Okay.
Thanks. Thank you.
And sorry,
Hi.
so Miss, in that case, they would have to turn off the IV for a
Yeah.
minimum of 2 minutes, you said, right?
Yes. Yes.
Okay.
According to the theory, what we are studying 2 minutes, but in practical reality, 2 minutes is not sufficient. Like maybe for
Okay.
10 minutes.
For 10 minutes, yes, you just
Yeah.
said it. Okay, thank you.
Anticoagulant tube, clot, whole blood sample. If there is
No.
if there's a clot
For whole
and there's
blood
a
testing,
no, you won't run. Why?
because it will not give an accurate result.
Accurate result.
For
The clot will be
especially
a
for
major
CPC.
interference, right?
Yeah.
And the next one, fibrin strands or clot, for example, in a serum tube.
It has to be aliquoted, ma'am, and then Rispan.
Most probably when you get a fibrin clot, in the case of a serum, what they do is it means the clot is there, the test results won't be accurate. So there is one question that you will be asked, even the ML Power, or repeatedly you'll be getting this. What if there is a clot in the serum tube? You have to pick the option of recentrifuge, aliquot the sample, and then you separate it, right?
Yes, that's right.
The main thing here you have to know, whenever you see a clot in the serum tube, this is a very repeatable question. A clot in the serum tube means the test results won't be accurate. There will be an interference. So here, rerun the sample, recentrifuge the sample, and separate it.
Ma'am, do we rerun the sample before aliquoting?
Yes.
Yes.
Then only you'll get the clear serum. The serum aliquoting means separation of two liquids.
Yeah, but I thought we were supposed to aliquot it before respinning it, then aliquoting it again.
Aliquoting,
no. Spin twice. Is
generally speaking, when we see a clot in anything, just for mainly the serum tubes, we first recentrifuge, and then we will do that. Because anyways, if you're going to mix with an applicator stick, again there will be strands. So how long you're going to play with it? This is a time issue, right? Time sensitive.
Thank you.
So there will be so many samples coming. For example, you have like 20 minutes and then to give the results to the MLT, but the thing is, it's there, then you cannot play. You don't have time to play with all those things. Even though they say first take the fibrin strands, then aliquot the sample, then respin, then aliquot and all those things. No one has the time for that to play. Anyways, we have to separate. So let us run, then let it be clear, and then we separate. Because anyway, the strands will be coming. Once when you put the applicator stick, you're not going to remove completely. It'll be there. I would suggest you go with the recentrifuging, and then it'll be settling down, then you take it. Okay? Clear? Or if you have time, time to play, you can play. First you remove the stand, put the applicator stick for 20-30 minutes, show it to your colleagues. Look, this is the strand that I'm getting. Now I'm aliquoting, and now I'm going to recentrifuge, and then now it's clear. It's up to you. So I wouldn't do that. I'll just, because we anyways have the option of recentrifuging. So what I have learned, whenever you see some clot or strand, just no worries, recentrifuge, separate. That's it. The next one, lipemia. Lipemia. Lewis, where are you? Where is Lewis? Is Lewis here? No sound? Mm-hmm. Yeah, I can hear you now. Yeah. Now, where are you? Just why you're not talking? I want everyone to talk. Lipemia. What will you do if it's a lipemic sample? What is lipemia then?
Where serum,
High level of
More
lipid.
fat.
like,
Very good. More fat.
yeah, like a milky
What will you do
white
if you get a
color.
tube with more fat? Anyone can answer. Can we run the sample?
No.
Yes, we can run the
Yes.
sample.
Yes, you
We
can.
have to do the, we have to remove the fat and then we get the plasma, right? Or serum. We have to remove the fat. So in that case, we have to put it in an ultra centrifuge, which means like more like detailed centrifuging where the thick fatty layer will be removed and then you can see the plasma.
Ma'am, I have a question with that.
Yes.
Yeah.
What about if there is no ultracentrifugation in the lab?
They have to send it to other lab. They have contacts. And then they
Okay.
have, that's how they work. That's how the
Okay.
lab works.
Thank you.
Hemolysis. Hemolysis or hemolysis, whatever you want to say. Like hemolysis, you can run the sample or not.
Yes.
Yes.
Yes, but what do you have to do?
The MLT has to have the
MLT
comment.
has to document. This is important. Documentation process is important. Then ITRIC, can you run the sample?
Yes.
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 What is the additional thing that you're looking for here?
Again, MLT has to add a comment about the sample.
Yes. Why we have to make a comment every time, guys? Why?
Because it will
results.
For
show,
the endorsement.
So
and also for the doctor.
doctor's
know that-
reference
yeah.
and also if there is
Reference.
any error. If there is any error, we will
Exactly.
be notified as like who made the error. Right?
Yeah.
And
Yeah.
we have to follow the protocol, a standard operating procedure in the lab. So the procedure, when it says like it has to be documented, yes, then the MLT has to document and we have to make sure about that. What if there is insufficient volume or NSQ? NSQ,
Maybe.
maybe we can run if it's a difficult draw, right?
Yes.
What do you understand by difficult draw? We talked about it yesterday.
It was if the patient have difficult veins.
The difficult vein, okay. And it's an invasive procedure. So what we will do, the next step.
You try to consider using the smaller tubes.
Very good. For a
And
short
also
draw.
test with the physician if what is the most important test that you should run first.
How will you make sure which one is the priority test? Who will like
The
assure that this,
physician.
Calling the
the physician? You have to call the physician. Yes, very good. You have to call the physician, right?
Yeah.
And then you have to make sure which is the important test that he is expecting and what he is expecting. And then we have to give the result. I mean, we have to perform the test. What if it's insufficient volume in a gel tube? Even for the whole blood, that's the procedure. If it is a gel tube, if it's a difficult draw, can we run the sample?
Maybe.
No.
Yeah, maybe, because if there is a short draw, what we can do, there are small cups, that can be run in the analyzer or manually the MLT can test and then they will just, they can send the results. But before that, they have to ask the physician what they are actually expecting, because you can tell them it's a difficult draw. We had only this much amount of blood. So what are you looking for? Which one I have to perform? So based on that, which tube like you can collect, you have to make sure the tube is collected and then you have to run the test, or manually the MLT can do the test and release the results to the physician. Because it could be a difficult vein or the patient is old, he is having a rolling vein. So in all these situations, this is the one that we follow. Okay?
Okay.
Clear?
Clear.
Okay.
Yes, clear.
Now, what if the gel did not migrate properly? It means the centrifugation is not done properly. So what will
Yes.
you do? Will you run the sample majority of the time? No, but if it is necessary, they aliquot the sample, they respin the sample, they re-aliquot into clean tube for clear fluid. Usually for these things, they will tend to discard and then they want to recollect the tube. If it is not possible, this is what they do. They won't run the sample in the analyzer. Okay? But do you think they will make a note out of it or they will document it? Will they document this or not?
Yes.
Yes, everything has to be
Yes,
documented.
miss.
Yes. Incorrect sample type for testing. What if the collection tube is, for example, you're collecting two tubes. One is the SST and the other one is lavender. You know that you have to collect this and then you print it out from the lab information system, one with the barcode for the lavender, one with the barcode for the SST. But now you're talking with your friend or the patient and accidentally you just you stick the lavender label to the SST tube and the SST label to the lavender tube. What is the result? What will happen?
It will not be accepted by the machine.
The machine won't accept. Okay, this is
Yes.
once again an important question that you have to always think about. If the labels are not labeled properly, then the machines or the analyzers, they won't accept. I experience this all the time because the micro samples come here and then sometimes in the tubes, and then I cannot load it because that has to go to the microbiology department, right? Or we put it in the query fridge where they have to sort out and then they have to send the proper tubes, proper labeled tubes. There's a lavender tubes to the hematology department. So these are all the issues. So in that case, if wrong blood tube is collected or wrong patient label is on the tube, you have to confirm the correct patient and test request, right? You have to call the doctor. Sometimes they will tell you to call the doctor to make sure this patient is given which type of test. So you have to talk to the physician. If it is correct, then check for alternative sample types for testing. Recollect if it's a wrong tube. Sometimes you can go to the LIS, you can print the necessary label if the patient ID or tube is correct. But if the patient ID is not correct, you cannot do anything. Or if the wrong tube is collected, you cannot do anything. So this you have to be clear. And expired blood tubes?
No. Big no.
No, you can.
No, a big no. Why? We talked about it yesterday. Why?
It won't give accurate results because of the
The
tube is
quality
expired
of the
and the
The
sample.
quality, you cannot
Yes.
rely on the result because definitely there may
Right.
be errors, right?
Yes.
So you have to cancel the test and then you have to talk to the physician and you have to talk to the lab. It can be a Dynacare, a Life Lab or Med Lab or MCA lab, and you have to tell them you have to recollect from the patient. But the physician also should know about it. So these are all the jobs of the technician. So once again, there is an important thing I'm going to ask you. If you are collecting blood in the SST tube and also in the lavender tube, okay, the patient ID is correct. As a technician, you ask the name, the last name, first name, and date of birth. Everything is correct. But while labeling, you made a mistake. You switched the labels. Now, what will happen?
That is supposed to be my question, ma'am. Because if, for example, I am the technician and I just put the wrong label, then I have to reprint and correct the sample.
Yeah, but you were talking and then you forgot about that, and then they sent it to the even the procurement department. They never checked it. Now that has been delivered to the purple tube comes to the hematology department. the SST tube goes to the chemistry department, then what happens?
Again, it will not be accepted by the machine.
It won't run.
It won't.
It won't
Even
run.
humans make mistakes. The machine is
Yes,
not accepting because the barcode label
exactly.
is not right.
Different.
There will be a code. I told you yesterday
Yeah.
there will be a code while running on the machine. So that code will not be accepted, right? It will
Yes.
reject the samples. Now, what can you do? I want everyone to participate. Only some students who are talking, they are keeping on talking. The others are quiet. Come on. Okay, Alexia, talk. What can you do if that is the situation? So I'm sending back to the query. So what will happen? What the query department will do about it? Anyone can answer. So I'm sending the samples back because, yes, Varna, go ahead.
The supervisor will ask if who did the test, and then if they know that the technician, example, I am the technician, I would tell the truth that I made it by mistake, and never blame others for doing the mistake.
You're talking about the accountability, right?
Yes.
Okay. That's one possibility. Okay, very good.
Yes.
Amina, you want to say something? No, Asinet? No?
Hello?
Yes.
Can you hear me?
Yes.
Okay. The patient's identification would have to be confirmed, and if it is the same patient and their identification is correct, it will be made. Yeah.
Then what's the possibility? First they will send it to the query department, the questioning department. The questioning department will write a comment. It's a wrong label, right? A mislabel. And now what they will do, once again, they will verify from which lab it came from, and they have to call the lab, and then they have to confirm the ID of the patient and date of birth. So if that is correct, this is a procedure. Then what they will do, they will print another label, okay, where the lavender label goes to the lavender tube and the SST label goes to the SST tube. Now they will once again send it to the bench. Then you can run the sample. Otherwise, the machines won't accept, but everything has to be documented.
Yes.
Okay.
Amina.
Ma'am, good morning.
Good morning.
Shahina, nice to see you. I have a question regarding this, right? That because in the hospital, because I also like to share that in the hospital, if we do any mislabeling for anything, it's no choice. Even our patient is there and everything, they will reject the sample if you collect in the wrong tube. So I am little bit, I like to know from you what you guys do in the life lab, because you are not going to get the patient right anymore, because the patient has given the blood and the patient left.
Yes.
Now you have collected the sample, you have mislabeled the tube, whatever the technician, and didn't notice it. If I understood, I just joined here, okay? So
okay, no problem. Good morning.
Yeah,
Nice
no, I just
yeah.
like if I miss, and then the tube has been mislabeled. It has been sent to the accession department. They have received it, and they noticed probably they had sent, because they saw the label and they send it. What you mean? They assist it to the chemistry, hematology department, because the labels are different. Even they send the assist to the chemistry and here lavender to the hematology with the wrong label. Obviously, when you will run the sample, the technician or technologist will run the sample, machine will not take it.
Yeah.
Up to that, I understood. So at this point, so for hours, patient sample is going to be rejected and they will ask you to recollect. Even you go in person, even our physician tell no, the patient is a very difficult pair, we can do that anything in hospital, no way they accept. But what happened to in your case in the Life Plus or Gamma Care, I have no idea. So at this point, when the analyzer or just reject the sample. So then you understand, oh, okay, in the hematology tube, we have the SST level. So now from this point, how we can verify that this is really the same patient, because right now the one tube has gone to the chemistry, one tube came to the hematology. Patient is not to it anymore. So if this is not the right tube or this is the two exchange tube, how you guys do that? I like to learn that.
It's a good question. What we do usually is, if in the requisition, if they are asking for a tube, but that tube we are not collecting, if we are collecting in a wrong tube, definitely we have to
wrong tube,
recollect
forget
again.
it. It's no,
Yeah,
no.
forget it. But if it is like switched, the labels are switched, when it comes to the department, like for example, the hematology department, before running the samples in the analyzer, I have to batch the samples. For example, in one load, if there are 90 tubes that has to go in the analyzer, I have to first batch. While batching that, I will be rejected in the
batching means? What
batching means there is a number given for a particular batch. For example, if I'm running the
accession number, that is the accession number you mean?
No, accession number is there. There is a batching number. Batching number is, for example, if 90 tubes has to go in an analyzer, starting from 1 to 90, I have to scan it. While scanning, all the defects, that is the NSQ, everything will be shown here. So I have to automatically, I'm not going to load it in the analyzer because I know now I cannot waste my time. That time I have to put it in the fridge, and that is for the query, but I have to in the computer LIS, I have to give the information that one
report.
sample.
You have to report it obviously. Yeah,
yes.
There's a wrong level or something like that.
And everything, and they will take care. The query department will take care. They will call them, and then if it is possible, if there is a right patient to everything, only the label has been mixed, then they will fix it. Or else,
now how they fix it? You doesn't have that idea. How they fix it from the query
they will
department?
they will take it from the LIS system. They will reprint.
No. My question is whether it is really the same patient or some other patient, because two tubes have go to two different departments already, right? So
it
they
comes
have
in
to
the same bag, right? It comes in the same bag with the requisition.
I understand. From the requisition, you have already taken out the two tubes, right?
Yes.
One already went to the hematology, one to the chemistry. The bag is not there anymore.
They will keep
you
it.
have already entered everything.
No. They will have that. In the procurement department has that. When we send to the query, they won't throw right away. They will keep it. So when we put it in the query people, they will pull that out, and if
that means you put the requisition in the bag, and the bag is saved. Because
everything
requisition is
there.
only one, right? Requisition can go to the each department. Only the requisition can accompany the biohazard bag where the samples came.
Yeah.
Am I right? Or understanding correctly?
Yes. We have nothing to do with the requisition. Only the samples come to us with the label.
No. But you said that they have to check with the requisition, whether the requisition from the same patient with the same tube.
That's in the query. That's the query department.
No, that's what I'm telling you. During the query time, so they are going to ask for the biohazard bag with the requisition, which came with the sample.
Yeah, to the lab from where it came from.
Yeah, and then they are going to send it to the lab.
They won't send it to the lab. If they verify if it's correct, they will just fix another label, and then we can run the sample. But we have to document it.
Even we document it even we go in person, it says probably 15 minutes time. If there's a wrong label, we go to the lab straight forward. Say, no, even we take the responsibility or write something. The doctors take the responsibility, except the CSF sample. They doesn't accept anything. This is something new to me.
So
I never heard.
Even sometimes when we get the micro label, wrong micro label, they will it goes to the query department, and then they will fix the label if it's the same patient, and then but that will be documented. If
even
the doctor,
for the babies, 1 day, 2 day babies, if the wrong labeling, no is no. I'm in hospital. This is new to me. That's why I'm just asking the details.
Because it came in the same bag with the requisition, but only the labels are mixed. So that's the reason why there's a chance.
No, how which till now, okay, when I'll go back, then I'll probably discuss with you instead of taking
I
your,
will verify.
instead of taking your class time. Yeah.
Yeah.
So, yes, I
Yeah,
hope
what
you
you
are
mean to
enjoying it.
say, when the labels are even shifted, that has to be rejected, right? That's what you mean to say.
No, like that, it goes to the LI system. We put the labels and other things with the requisition. We don't need to put the requisition because it's already the system. So we put the label. When they go to the receiving department, immediately they scan it, right? When the receiving or accessing department immediately scan it. Even there, they said that even immediately they catch the wrong label or something, immediately they reported that wrong label. So you have to redraw the sample. Does the message come to us? So even we go there, oh no, sorry, I made a mistake or something.
But in
Yeah,
the
they
life
doesn't
labs,
accept it. At the same time, I have to file an incident report. That is my mistake. I did that.
yeah, but here
The lab will send one report, and I have to file one report.
Yeah, but
so that's why I just like to know. I have no idea about the query department and other things. This is new to me. This I never, because I never worked in the life lab or Dynacare. So that's why I like to
there is a
know.
query department. It goes to the query department. If it is, if this is coming in the same bag with the same requisition, then the query people will inform, and then they will just fix the proper label and send it to the respective department. Anyways, we cannot run because as a technician, I have to batch it.
No, you cannot do that. So until the query, you have to be your safeguard, right? Otherwise, any problem, it is going to be legal lawsuit on you.
Yeah. So no, we are not supposed to do that. So that's why the query people or the procurement people are in charge. Sometimes when it comes, so as a technician, what we should know here at this point speaking, like we cannot run because the analyzers definitely is not going to accept. That's the thing. This up to this point here, we are making clarification. Further, what the decision has to be made, the supervisor will make a note, and then we will put. I go put it in the query area, but I will make in my system that sample mislabeled.
Okay, your job
and they
is
will
done.
take care. Yeah.
Okay, basically you can understand from Sahina. I didn't know that. So your job is to do the label. Keep the samples with the informations and report the system. Then whatever the instruction will come from the query department, then it's done. But your job, what Sahina is telling, so you are not going to run the sample anyway. So your job is to take the information, mislabel whatever the information Sahina is telling, just do that. Thank you, Sahina.
You're most
Thanks,
welcome.
I joined in the right
in
time. How is everyone? Just good? Everyone is
yes,
good?
ma'am.
Yes,
How
we're
is the
good.
cold? How is the
Thank
cold now?
you.
How is the
We're
cold?
listening intently to your exchanges. Thank you. We're
No,
learning a lot.
I like to be a student today, right? Every day I speak. Today I like to be a student. So that's why I am today Sahina student, right, Sahina?
No. Nice to see you here in the class. So basically, the question can be like whether you can run the sample or not. The answer should be no. You cannot run the sample.
Okay.
Yes.
No, I just like to check whether the system is working. That's why I said, okay, send me link whether I can join or not. So that's why I just
good. So how are you? How was everything?
Oh, I'm okay. I went to see the orthopedics today because pain is unbearable. After that, I was crying almost in the flight, and after that, then yesterday I went to the orthopedics. Today again read the X-ray. They gave me a lot of medications. So and they like to see after the X-ray whether there is a lot of hematoma deposit. And after 4 days taking the medicine, if the fluid doesn't go, they have to aspirate the blood from the knee hematoma.
Oh.
So right now I'm this condition.
Oh, sorry about
In
that.
Take
class.
care. Yeah, sorry about that. Take care.
Sorry to
I
hear
hope
that.
your students. I hope your students are enjoying my class. That's I don't know.
Obviously, they are already know you. So that's
No,
why
they know me.
that's why that's why I dared to join to be a student today.
Oh my God.
Yes, we're enjoying.
Yes, we're enjoying it. Yeah.
Yeah.
So
No.
we are talking from the exam point of view, like basically. So it's all up to the safety protocols or the standard operating procedures of the lab. Each and every lab, they follow different things.
Very
But
good.
at
Because
the end,
you are taking that exam on Friday?
Yeah, I think they are taking it on Friday. So
they have to, because next week you are going to be in the lab, right? Yeah.
Yeah.
They should be ready by Friday. for
Yeah.
taking the exam.
Yes.
And then they have 1 week for the lab, and then you are going to do the again. I send you the chart, right? I already send you?
Me, yes.
Saina?
I received
Yeah,
it. Yes,
yeah.
I received.
Okay, okay.
Thank
I'm
you.
not going to
Thank
disturb
you.
you guys. Sorry for disturbing, but nice to see you all. Okay.
Nice,
So
Nice
Nice
to
to
see
hear
nice to
you.
hear your voice, ma'am.
Nice to
Yes.
hear you.
Yeah.
Yeah.
Enjoy the
Thank you.
class. Maybe if I get chance, I will be sneak on and sneak up to see each one of you because I'm missing you, including Saina. So
Oh.
yeah. So,
Very
yeah.
nice of
Oh,
you. And
thanks,
thank you.
Miss. Enjoy.
Thank
Enjoy.
you.
Yes,
Thank you.
enjoy.
Okay, everyone. Okay. Enjoy your class. Okay. Okay.
Thank you.
Okay,
Okay.
bye.
Okay.
Okay,
Okay. Bye.
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 Can
Thank
I
you.
ask you a question, Miss?
Yes. To me or Munmun? Like,
To you.
okay. Yeah.
Uh,
Ying Hong, yes.
About pre-analytical integrated check, we just went over the form. It's insufficient value, difficult draw.
Difficult draw. Uh-huh.
Yeah. It's the first line. We have two difficult draw. It's for first is whole blood. And the second is with gel tube.
Gel tube. The SST tube, you have the gel, right? That type of tubes. We have a very small draw. Okay.
Yeah, I just want to clarify. The whole tube as CBC's lavender tube or red tube. Right.
SST is golden yellow.
SST
golden
is
yellow, because the red tube doesn't have anything like to run. So you have to run the one that has a gel and also the anticoagulant, right? You're going to separate the serum, and that's why the serum separation tube. Yeah. Okay, go ahead.
Yeah. The second with the is if the gel present in the tube, so the gel tube is the SST tube, right? That's my question. Thank you.
Yes, the SST tube. When you come to the lab next week, you will see the gel sitting there. You'll see the gel. That's to mix. That's the clot activator gel.
Okay.
It allows it allows the blood to form a clot quickly, so that you can run it in the centrifuge. Yes. That's your question about the gel.
My question is we have so for whole tube
Yes, the EDTA for example, yes. EDTA tube.
Yeah, if EDTA tube, if difficult to draw happens. So and another is gel tube. What is the difference to like we should handing? What is different with this tube? For all both is a difficult job.
If it's a difficult draw, you have to call the physician that we have only collected this amount of blood. Which is the test you want to do? So based on that, you have to ask them which tube is important. So they will tell you what to do, the physician. Based on that, you have to tend that particular result. Or they will run, the MLT will run in a small tubes. Manually, they will test. That's also possible. You have to contact the physician. They will tell you which test is the first one that they need to see the result, and you have to run only that particular analyzer and send the result. They want to see something very important, but only you have this much amount of blood. So instead of the other tubes, the one that the physician says is important has to be prioritized. That has to be sent first. We have to run that sample in that particular analyzer, and then we have to send them.
Okay, so we call a physician first. So like we take the same procedure for whole tubes or gel tubes, right?
Yes.
Okay, I got it. Thank you so much.
You're most welcome. Even in the PowerPoints, we have that, right? We have to ask the physician for the prioritizing test. And then we have, for example, if he says, I want to see the electrolyte, the potassium level. So you send only that to the chemistry department. If he says something like, oh, no, I have to see his, the ESR result. So then you have to run the lavender tube first, and then you have to send the result to the doctor. Because if they are in particular, they want to see something, they will tell you what is important for that particular patient, what they are looking for.
Okay, thank you.
You're most welcome. Any other questions? So the whole thing is very important. That's why we have to go that in detail a little bit. Okay.
Yes. The insufficient volume, whole blood tube. So what does it mean? What may need to be run in open mode? What is open mode?
Open mode or recollect. Open mode in the sense they will just have a small cup like thing where they manually they can test. The technologists can test it. They do that in the lab. Instead of running in an analyzer, there are small cups that where the technologist has to sit and then they will do the tests.
Okay.
Then they will send the result. Or if they want to run it in the analyzer in particular, so they have to, we technicians have to contact the doctors. The doctors have to prioritize the tests, and then we will only first load that analyzer and then we will send the results.
Okay, got
because
it.
it's a short draw.
Okay, so it's going to be like tested manually.
Yeah. So
Thank you.
some tests when we cannot run in the analyzers, because even for the urine, if it is a NSQ, we will give that sample to the technologist, so they will do it manually, and then they will put the results manually in the computer, and they automatically the result goes to the doctor.
Okay.
Okay.
Okay,
Yeah.
got it. Thank you.
Yeah. So if you have any questions in the lab like this, then you can talk to the technologists. They have their own protocols, what to do, and they will tell you what to do.
Okay, got it.
They will
Thank
guide
you.
Yes.
I have a question, ma'am.
Yes.
Is it possible
to
have these two situations where the plasma or serum is both hemolyzed and enteric?
Yeah.
So
due
what
to
do
some
you call that
conditions, I told you the maybe due to the hemolytic anemia, that's one thing we have seen, right? So if the
what do you
person is having hemolytic anemia, where rapidly the RBCs are destroyed due to some disease conditions, so the blood, when you draw, the serum will have the hemolysis, and then even the plasma will have the hemolysis, and then the doctor has to figure it out, like what's going wrong, and then that's based on the test result.
Yes, ma'am. The thing I'm asking is, can you have it both icteric and hemolytic?
Why
Like,
not?
Call that
why
color?
not? Because
What
yes.
do you call color? Will you say reddish yellow?
Yeah, reddish yellow, yes.
So you can now say what is this condition? You say it is both hemolyzed and icteric.
Yes, so it has to do with the damage with the liver also. So there is some liver condition or the liver illness, like the disease is there. So the doctor will see what need to be seen. So you don't have to worry. Whatever you are doing, but based on the color, it's a good question. Sometimes it's 2-in-1 combination. Color will also be there. So the doctors will figure it out, like what is it?
A question came up, myself and Masnat were discussing, and the question was like, I think what condition is it when the color is reddish yellow? So
possible. Yes.
Yes, I was thinking, is it that it is a very high degree of being icteric, or could it be hemolyzed and icteric at the same time?
It can be the both condition, because the liver, the RBCs, they need something to be checked. So they will figure it out based on the enzyme that they are looking for in the chemistry.
Okay, but if we're in an exam and it says the color is reddish yellow, can I just say that is a very high degree of icteric? Or
you won't ask that type of questions.
Okay.
Okay. People are not there to complicate you.
Exactly, that's too complicated.
Yeah, you don't have to be that. You don't have to squeeze your brain that much. Okay, just know like which you can run, which you cannot run. Where the MLT has to document, where you have to document, all those things. What happens if the labels are switched but with the same person? What if the person and the requisition is different? What if the collection of the blood in the tube is different? For example, they are asking for lavender and the technician has collected only the green tube or the blue tube. All these things you have to know. It means it's no. The tube itself is wrong. You can't do anything about it. Okay?
Thank you.
You're
So
most
much.
welcome. So Is it clear with this specimen integrity table? Because this is something very important, so I have to go through this in detail. Okay?
Last question,
Yes.
ma'am.
Yes.
I have a follow-up question regarding the what you have discussed with Dr. Moon with Ma'am Moon regarding the technician. For example, the query department has already the sample with mislabeled, but it's a correct patient, and query department will ask the technician to come and relabel it, or just by verbal.
No. The nurse,
For
mainly
example,
if it's a hospital, even in the slide it's given, if it is a hospital, they have to come and they will sign the waiver form and then they will fix it. If they have a doubt, if they feel like that only the label has been switched, then they will do that. If they have to make the decision, if they feel like they have to recollect the blood, then automatically they will contact the physician. Actually, everything will go to the physician. The physician will call the patient again, and then he will just again, once again, give another requisition. If they have a doubt.
What about for life labs? For life labs, ma'am.
Life labs, usually if it is like a label is not clear, if it is like that, then they will document it, and the query department will check if it's the same thing. Then they will just put the labels, right? Because only the labels have switched. The name, everything is okay. Yeah, they will do that, but they document it and they will send the information to the lab where the phlebotomist has performed the job. They will be notified. And the doctor will also be notified. Okay.
Right. Thanks.
Okay. Yeah. There is a query department. There is a query fridge, and there is so much things in the life labs. Okay. Because we get samples from so many different labs coming.
Exactly.
In the core lab, it's a very huge center. Yeah, it's a very huge center coming from far places, like from Caledon, from even we get it from the Niagara Falls. Yeah, Kitchener, London, Waterloo, Guelph. So many samples come. Burlington. So it's all the time busy. We are busy all the time.
Yes, that's right.
Yeah, okay. So now, is it clear? Any other questions? Because we are going to start with the lab balance today. We have to cover 3 more topics: the lab balance and the pH meters and also the refrigerators, which we knew we have done this, but still we have to go through this information. Okay? Clear? Any questions? Boring? Miss too much information? How we are going to study?
No, clear.
How we are going to study?
It was
by
good
repeated
review.
revision. That's why we talk about these things.
Yeah, it
One
was
is
good.
specimen, labeling, running, analyzer, right? Okay. Clear? Can we go to the next?
Yes, please.
Once again, I'm asking the final question. What if, based on the requisition, if a technician has collected in the wrong tube, will it be rejected or accepted?
Rejected.
Very good. Yeah. What if the labels are there, but it's not on the tube?
Rejected.
If it's
but there's a possibility of calling the
happens.
physician or the nurse if it's a hospital.
Right.
Yes.
Okay, make the waiver form signed and put the labels. What if you collected the label for 2 tubes, everything is correct, only the label switched?
Correct it.
Again,
Yeah.
They can correct
the
it because
doctor-
the analyzers won't accept, so they can
Yes.
still do that, but they had to be documented. Again, it's up to the query department. Okay.
That's right.
Yeah.
Yes. Okay. Next. But the bottom line is the analyzers won't run those samples. Okay. This you have to know.
Yeah.
Because there's a specific code for the specific department.
Yes.
Yes. So next. Can you see this? Lab equipment.
Yes.
Yes, I'm
Thank
sharing
you.
this and we're going to start this lesson. If you have any questions about the specimen integrity, tomorrow is Thursday. On Friday, we are having exams. So tomorrow can be a revision day. So we can revise a lot. So now, clinical lab science. This is the book that you have to refer when it comes to the balances and equipments. Chapter 6, Systems of Measurement, Lab Equipment and Reagents. And why we have to study about these? To describe how to use a balance. Now, what is a balance? What do you understand by the term balance?
For weighing.
Okay. Why you have to weigh what you're weighing?
Chemical
Yeah.
weight.
Chemicals, but it can be a solid or liquid.
Liquid.
Both.
Both. Okay.
Yes, ma'am.
You have to change the containers. If it is a solid, you're going to see the weigh boat. The weigh boat is a plastic small cup-like thing that you put the salt or whatever dry substance, dry chemical, that you're going to mix it as a reagent in the lab, and then you're going to use that. But if it is a liquid, it will be in a beaker or a flask. So that's how you're going to weigh. What will you do after weighing the chemical?
Clean the balance.
Clean it. So cleaning is also an important part of using. So we are doing the job all the time. We are going to clean.
Clean after use.
After use. And how we are going to clean the balance is very sensitive because we have to take care. Otherwise, it will cause error when you do it the same thing next time. So again, then you have to call another person from outside to calibrate it. Till that you have to wait. So we have to avoid all those things. We have to take care and we have to maintain the equipments in the lab. It's important. So what are the balances that you have seen in the lab, in this lab? We'll just go through, but in a very quick way because this and all we have covered. The important aspects I will explain. Otherwise, you know majority of the thing, right? So we have talked about the balance. I did the skill book, so you know about this. Balances or scales are used for weighing. They can be mechanical or electronic. What is mechanical? What does electronic means? What do you understand by this term?
It's digital.
Digital? Digital is what?
Mechanical is more old school.
Old school. You have to
Electronic
perform
is plugged
everything.
in.
You have to look for the scale. Am I right? There is a scale that you have to look for the needle, the pointer going this side,
Yes.
that side. Electronic
Yes.
means immediately the numbers are there in the monitor. That's the difference.
It's the digital, yeah.
Yes, there are different balances used in the clinical lab based on the accuracy of the mass required to weigh. This is an important sentence because some are very sensitive. They can measure up to 4 decimal digits and some weigh up to 2 decimal digits. So you have to know before starting what you're doing with the balance. You cannot expect a weight of 5 kg if the balance says it accepts only 3.5 kg. Agreed? Or in other words, if a balance says only 3.5 grams is acceptable, you cannot put 5 grams on that and you're waiting for the result, wasting your time. We don't have time to waste in the lab, so you have to be very clear about these things. So in the lab, the two most common balances. Now, this is an important question. In the lab, the two most common balances that are used, analytical balance, top loading, or precision balance. Now, what is a top loading balance? Anything in any balance where you have to load it on the top. And then when you see the weight, then it's called top loading. Then what is this analytical balance? You have seen the top loading balance in the lab, yes or no?
Yes.
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 What is an analytical balance then? What do you understand by analytical? What is analyte? Analytical.
With that, I
It
think
can
just need to measure accurately.
Measure
for
something
for
accurately,
4
which means it's
digits.
very critical or very sensitive.
Yes.
Right? Talking about
Yeah.
in the form of the word that has been coined, it means it's very sensitive. Now, when it is very sensitive, what are the things that you have to look for? Will you look for the place where you're going to weigh, the environment?
Yes.
Yes.
It's sensitive to environment. Next, is it sensitive about the cleaning procedures?
Yes.
Yes.
Yes, it's very important. Yes, the cleaning should be done properly because that can damage. And we are looking something which is really, really critical here for the critical measurement. And now, proceeding to the electronic balance, how it will look like. This is the one. We have this in the lab. It has a digital readout display, which is here, right? And used for critical weights, varying levels or accuracy is available. Maybe top loading or cabinet style. So the cabinet style balance can be an analytical balance, which means there will be a cabinet or a door or a glass box where it is kept inside. Why? Because even the movement of air or the particles in the air, when they move, then that may affect the weight. So it's that sensitive. So it has to be in a cabinet. Now, when talking about the comparisons, these are the two. We don't have analytical balance. Have you seen the analytical balance in the lab? No, we don't have it.
No.
We don't have it. But the other labs, they have it. Definitely they have it. They have to mix, they have to measure, they have to mix the solution and something, so they have it. And the top loading, we have it in the lab. We have so many, right? Now, in the analytical balance, you see there is a glass door and there is like a tear button. What is a tearing? Tearing means what?
It gives you the weight of
To
the
set
bone.
the measuring into zero.
Set to zero.
Zero. Setting the balance to zero from where you get the accuracy when you put something, right? So it has to be balanced. And there's a balance span. Anti-draft ring. This is a very important term. What does anti-draft means? If anything, you keep it on the top, the balance shouldn't be affected. So that has to be properly secured on an uniform plane. For that, there is a ring provided. That's called the anti-draft ring. This you should know. And there is a level of adjustment. That's the feet. They have a rubber stopper-like thing. They have it. So this is how an analytical balance will look like. This talking about the cabinet style or analytical balance. Why we are using this? To measure even a very small quantities with great accuracy. It should be, the measurement should be accurate. And it's very sensitive. And even it can measure up to 4 decimal places. What do you mean? Give example for this 4 decimal places. It can be used for minute measurement. It means 1 gram, 0.1 gram, 0.001 gram, 0.0001 gram, something like that. It's that sensitive, very minute, right? Clear? This one, the 4 decimal places. Now, underline this statement because, or this sentence, because this is an exam question. How many decimal digits can be accurately measured by analytical balance?
4 decimals.
4 decimals. Or, in other words, if you get a question, analytical balance can measure up to dash decimal places, 4 decimal places. Yes. And
It's a
which
cabinet
balance?
style.
Yes. Yes, Varna?
Mom, it's nothing. Sorry.
Or which balance is used to measure an accuracy up to 4 decimal places? Analytical. This is very important. Just keep this in mind. Have a draft shield so air currents do not affect the measurements. We talked about it. Good idea to put in a dedicated spot to prevent environmental and interference. What do you mean by dedicated spot? A spot where no one goes there or touches that, and it has to sit on its own without any interference. Okay? And make sure they have given an example of vibrations. If you put this close to the centrifuge, then it's a no. Why? There will be a vibrations, right? So it's not good for the balance. And it requires constant calibration. What do you mean by constant calibration? Why?
Because
Because
it's
it's
so
a very,
sensitive.
yes, Kara, go ahead.
Because it's so sensitive that it
It's so
requires
sensitive.
constant- yeah.
Yes, and we are looking for accuracy. When something we are looking for important thing, we monitor that, right? So this is a way of monitoring whether it's working correctly or not. Some have automatic internal motorized weight for calibration. Okay, so some analytical balances are built in for calibration. So we can put the weight and we can check it. Or there's a button that we have to press it where it calibrates. Often labs use external standardized weight for daily checks, which means we have to, I will show you a box in the slides. There is a box with weights and we are not supposed to even touch it. We use the forceps to take the weight and to put it on the balance to calibrate. This is how we calibrate in the lab. We have it here. Clear? So the importance of analytical balance, it shouldn't be close to a centrifuge. And then we have to calibrate then and there for accuracy. And for how many decimals, it can be decimal places, this can be measured?
4.
4. Keep this in mind. Very important. Okay?
How usual do we calibrate?
For 2 decimals, 3 decimals, but this is even more, even this lesser amount can be measured with accuracy. That's why it says 4 decimal places.
No, I meant how often do we calibrate?
This one, before,
Yes.
for this one, for example, daily you can calibrate, but then and there you have to calibrate it. When you're weighing something, you can calibrate it. But we do it 24 hours. Like in the lab, they want to do 24 hours. But here in this college lab, we don't have it.
Okay.
Depending on the usage, when you're using it frequently, the frequent calibration should be there. When you're using once in 6 months, then you just randomly one day you pick and then you calibrate and you make sure it's working well. And we also have a policy, the college policy, where the outside people come once in 6 months or once in a year. They calibrate. In this August, we did the calibration for all the equipments. All the equipments were calibrated.
Okay.
There is a sticker there. The calibration date is written. And there's also mentioned when the next calibration date will be. The next will be July or August. Till that, all the equipments are fine. And what about the top loading or precision balance? This balance is semi-analytical. It means there may be errors because of it's open. Like we measure in the lab, we keep it open. So the top loading balance. So there may be air currents. It's not that accurate, but it's not bad. It's not a bad idea to use this. We can measure. And readability of 3 days. Now look at the sentence. The comparison is given. Once again, I'm repeating this because this may be the exam question. So in the analytical balance, close to how many digits you can balance?
4.
For what? Decimal places.
Or decimal digits.
Yeah, here 3 decimal places or less. Or can be 3 decimal places, 2 decimal places, 1 decimal place. That can be weighed using the top loading balance. But it's faster. So now when you get a question, which balance is faster in measurement?
Top loading.
Top loading or precision balance. 2 options, precision balance or top loading balance. Now these are less sensitive to environmental factors, which means you can do it in an open space, right? But still not close to the centrifuge. Can also use external weights for daily checks. So daily you can check, but as I told you, how you will check, there is a separate box with the weight. So you use the forceps, you don't even touch using your hand. You just put it for weighing and then it can weigh. Most common and less expensive. So these are the most common ones. So we have this in the lab. The analytical balance are very expensive and it's very sensitive to handle. Only the people who use it for critical measurements to mix and to make a reagent, they use it. This is less expensive and most common than the analytical balances. Electronic and self-balancing, which means when we use it, most of them top loading or electronic, right? They can be plugged and they can be used. And have you seen this balance in the lab?
Yes.
Where?
Yes.
Where?
The dirty
In the
sink
corner.
area.
In the corner, very good. So in the corner, yes. What is the name of this?
Beam balance.
Triple beam balance or beam
Beam
balance or triple
balance.
beam balance. Okay, and this is very, very mechanical. You have to adjust everything. You have to push the needle to 0 for tearing, and then when you keep a weight, you have to move that where the beams can balance. Okay, but this can weigh an accuracy up to 1 decimal digit, which is 0.1 gram. Okay, which balance is used for 3 decimal places or less?
Uploading.
Which balance is used to measure at least 0.1 gram?
Triple beam balance.
Triple beam. Which balance is used to weigh up to 4 decimal places?
Analytical balance.
Very good. So keep this in mind. It's very
So
important.
this triple beam balance is 1 decimal place.
Yeah, 1 decimal place. So here, when you see the scale is there, but 3 beams are there. 1, 2, 3 beams are there. That's why triple beam. So we have the scale here. This is a beam. The pointer is there. And every time you have to do the manual tearing for 0. The balance has to stand in 0 position. Then you place the weight. Then you move it mechanically till it get balanced. So it's totally mechanical. There is a pan. The 0 adjustment screw is also there. So there is something to slide to balance. Now, what we have to see when we are using the balance, we have to see that whatever we are going to weigh, it should be in a proper container. And the chemical that we are going to use, we have to take care of our safety first. Where will we get the information? From the SDS or safety data sheet. We have to wear the proper PPE. And we shouldn't blow using our mouth. If in case it falls on the side, use a proper tissue and wipe it. Before that, you wear a mask because you don't have to inhale the chemicals. You don't know who is allergic to what. So these are the precautions you have to take. Okay. And once again, what are the safe work practices where the eye protection, eye goggles, or face shield, wear mask, and wear the gloves, lab coats, the same PPE that we are wearing, but the only additional thing is we don't wear goggles often, so this you have to wear the goggles. Remember, while preparing the bleach, you have to use the goggles. Do you use it? No?
Yes.
No one is
Yes.
telling anything. Almost everyone is preparing the bleach
Yes.
alternative. Yes.
Chemical fumes.
Yeah, because according to the SDS, we have to wear the goggles when we are using an acid or a base like bleach is actually an alkaline thing. So we have to wear the goggles because we don't want the ice to take the fumes or the aerosols coming out of it. It's for safety. So wear eye protection, mask, everything. And clean up spills around the balance immediately. And how to use a balance. Read the balance instructions prior to using. For example, if it's a triple beam balance, you should know how to calibrate it to 0 first. That's a tearing. And then you put the weight and slowly you move the sliding object. So that has to be balanced to give the result. So you have to know the instructions. If it is an analytical balance, then you have to wipe the area before placing something on the pan. You have to make sure nothing is on the pan, and then you have to close the door because for the analytical balance it's very sensitive. Even the air currents affect the balance, so you have to close the door. So all these procedures you have to use it. So balance should be clean of debris. Can be used a brush to clean, a small brush. Sometimes the labs have the very minute soft bristled brush. And the balance should be on a level. It shouldn't be in a slanted surface like this or this. It should be balanced, uniform plane. Never place a sample directly on the balance, right? Because the sample, you think you have cleaned it, but sometimes there may be some left outs. And for the next time when you want to balance something, you won't get the accurate result. There'll be residues forming out of it, and we don't want that to happen. That's why we use a plastic boat, a weigh boat, or a paper. Minimum, if you don't have a weigh boat, a paper. You can put a paper or a dedicated labeled container. So if you're going to perform this often, there'll be a container label that's for the salt. This is for the copper chloride. This is for the some other copper sulfate or something like that. So it should be labeled. If the balance is a draft shield, what is this draft shield? I talked to you about it. It's like a rim-like thing we come across here. You know, the metallic round thing that's shiny below the balance span, there's something shiny thing like a ring. It holds the balance to avoid any movement. This is called the anti-draft ring. If you have any anti-draft ring, then what will you do? If it has a draft shield like that, close the doors before taking the measurement, which means it's very sensitive. Nothing should get inside, not even the air. So you have to close the door. And see the link for how to clean a balance by Mettler Toledo. It's there in your D12. So after the class, you can go through that, or we can go through that step by step how we have to clean, because it's the same steps that they are telling. Okay, do this, do that. You have to use something like a weigh boat. You have to use a paper. You should clean it. Yes, Yusra? Question?
No, sorry, that was by mistake.
Mistakes? Good mistake.
Yeah,
Anyway,
sorry.
no problem. See the link for how to clean, or it's there in the D12. So we can go through that step by step. The same procedures, as I said, don't use it. And then you have to make sure that the place is not sensitive. It's very sensitive, so it shouldn't interfere. The balance shouldn't be interfered. And if it is an analytical balance, it's very expensive and sensitive. You have to take care of more things. Like you have to close the door, you have to clean the inner surface. If there is anything that you already, you have to do the calibration before starting. All these things are important steps. So that's what they're talking about. And how to use a balance. Once again, these are called the weigh boards. Can you see the weigh boards here, with the small plastic one, the big one, and the bigger one? We have the weigh boards in the lab. So when you come to the lab on Monday, we can talk about it. So you can measure one of two ways. Place the empty label weigh board on the scale and press the, no, there are two ways. Actually, what they are telling, you can first put the weigh board on the top of the balance and you measure the weigh board. For example, if it is 2 grams, if the weigh board weighs 2 grams, then you just document it or you note it down. And if you want to take 8 grams of something, on top of this, you put the 8 grams to balance. So how many grams total you will get?
6.
If you take out the 2 of the weigh board, right? So this is one way of measuring. But if you want to do the other way, you keep the weigh board and then balance it to 0. On top of that, you put the 6 grams and you take the weight. So 2 ways you can use. First, you weigh the weigh board, then you put it and then you subtract it. Subtract the weight of the weigh board. Or you put the weigh board, bring it to 0 level, and on top of that, you can put the chemical that you're going to measure. So 2 ways are there. And what do you understand by the quality control? Quality control is something that's very important. Even in the analyzers, we do it. Even for the glucometers, we do it. Why are we doing the quality control? Why it should be done? And mainly the technicians will do this job. Why do you think that we have to do this?
To have a quality of results.
Quality
Like
results, the accurate results. That's
accurate,
the main thing.
the precise,
to get the accurate results.
Yeah.
It's part of the
And-
quality assurance, and
yes.
it's part of the quality management of the lab also.
Yeah.
And
a reliable.
You can rely on this.
Exactly.
Yes. You can rely on the results. You can very well say, okay, I have run the QC, which means the results are going to be good. That's the quality control. And whose job is this anyways in the lab?
Technician.
Us.
It's the
Technicians.
job of the
Technician.
technician. So you have to be thorough with the procedure of performing the quality control, which means I do the quality control every time when I load in the analyzer. For example, if I'm performing 12,000 samples, I have to run in an analyzer in an 8-hour shift or 7.5-hour shift, half an hour for the break. In that case, for every 3 hours, the standard operating procedure in my lab is for every 3 hours, I have to run the quality control. And once when you run the quality control, when the quality control passes, your technologists will let you know because everything is computerized. So automatically this is connected to their computers. They will check, okay, analyzer is passed, analyzer 2 is passed, analyzer 3 failed, something like that. The same here. When you what is the quality control here for a balance? Are we going to pass with any chemical substance on top of that?
Calibration.
Calibration, very good. So what do you calibrate here?
To make sure that it's weighing accurately.
So the name itself is balance. It means we are balancing using different weights that's been given for calibration. And if it is showing the correct or accurate result, which means it's passing. If the balance is not working properly, for example, I'm putting something for 2 grams, and if it's showing only 1.5 gram all the time, if it's not balancing properly, it means there may be something wrong. So we have to call the person who just calibrate this, and they have to check, they have to fix it. Still, if it's a problem, then we have to order for a new one. Clear?
Clear.
That's a quality control for a balance. So keep balances clean, wipe up spills, protect the balance from jarring and tearing. What do you mean by jarring and temperature extremes? It shouldn't be kept in a very cold environment. It should be in extreme hot temperature. So it should be like a moderate temperature. Keep in this room temperature. Keep in one place. Don't move from today. You're shifting the balance in from that table. Tomorrow you're shifting to some other table. And on third day, you're bringing it to the class table. This is a no. The balance should sit in one place, peacefully rested, right? We depend on the balance. The balance never depend on us. They have nothing to do with us.
Just like free of vibration, ma'am.
Free of vibrations or any interference, I can say.
Exactly.
Keep in an area free from drafts and vibration. Level the balance with leveling screws. What do you mean? If you are mechanically calibrating, example,
If the beam balance.
Very good, the beam balance. The beam balance, there's a screw that you have to adjust for tearing to bring it to the 0 level. Then you have to once again put the whatever you're going to weigh, and then again you bring it to you move the weight until it get balanced. So this is, they're talking about the screws. And check 0. What is this called?
Tearing.
All the time when you start with the balance, start with the balancing of 0. That's called the tearing.
Tearing.
Yeah, tearing. Some people say British accent tearing. I have to have a dictionary here now because people when come from different countries, learning from the different speaking, then I have to say, wait, this is British, this is American. The best example, Amazon. So I've been taught Amazon since my childhood. When I came to Canada, like long time ago, I'm talking about 20 years ago, first time when someone asked, I got it through Amazon. They said, no, dear, that's not Amazon, that's Amazon. Oh, really? Okay, from that day, it's Amazon. Balance, but English, my professor taught me, or here when I studied, my professor taught me, if you're communicating well, if people are able to pick up your words, that's fine, no worries. Okay? So balance quality control. Always use container for weighing the chemicals. Of course, we have to use a container. What will be the result otherwise? If we are putting something directly on the pan, what will happen?
There could be chemical reactions and stuff like that.
Yeah, that it can corrode the balance, or there may be something that can affect the balance. So the next time when you weigh something, there are chances of not getting the accurate results. So even if you calibrate day by day, something can be like mixed up with the thing and it won't work properly. There are chances of getting that one damaged. So we have to take care. Maintenance is our job. Whose job?
Technician.
Ours.
Always maintenance of the equipments is our job. When you go to the lab, can you see so many things that are there? The log sheets that you sign, centrifuge maintenance, BSc maintenance, microscope maintenance. Tell
Yes,
me.
ma'am. We do have document all our daily readings and everything that we do every
Water
day.
bath maintenance,
Yes.
incubator maintenance, refrigerator maintenance, freezer maintenance.
Yes.
All the
Every day.
machines,
Yeah, all
yes.
the machines. Why? Because it's our job, right? That's why we get the training in the college. And even in the workplace, I do the same. I told you. While I'm starting the shift, I do that. End of the shift, I have to do that. And not only that, I have to endorse when the other batch is coming, when the other technician is coming for her shift or his shift, I have to show the documents. Look, I have documented this. Now this is what it is. And then you take care. That's it. Now, tearing reset to 0 after empty weighing container has been placed on scale. So you have to make sure when you put the weight, the weigh boat, either you have to bring it to tearing to weigh, or you have to take that measurement and you have to subtract. That's your job. Know your balances sensitivity limits. All about the balance you have to know. All about the equipments, whatever you're doing, you have to have a knowledge about it. So we are multitaskers, we are more knowledgeable, we are more accountable people, we are more responsible people, right? We are the people for quality assurance. So many things, commitments. So you have to be very careful. And we are the main people when it comes to medical field. Without us, tests won't be performed. It will not, naturally the machines won't pick up the thing and then they put it. They have to be run by someone. We are that someone. So we are important. Again, there is a point here. If you can know the maximum limit for your balance, if you are looking for 5 grams and you have put in a balance where it can weigh only 2 grams, do you think it is feasible? It's reasonable? Or it is possible?
No, it's not.
No. So you have to know that, okay? This is what I talked about, the calibration box, the box with weights, with a forceps. It will be written calibration weights for the balance. We have this in the lab. I can show it to you. So this box has different balances and the amount will be written there, right? In the form of grams or as per the need of the balance that you are having. And you have to use the forceps and then you have to put it for calibration. You check before beginning to weigh something. We weigh it on a daily basis if you are routinely using it, or sometimes you can use it after one measuring. So if you feel like you want to check the calibration, you can do it. But people who rarely use this, they can at least do once in a year or once in 6 months. And calibrate regularly with specialized weights. This is the one. Follow manufacturer instructions for maintenance or annual maintenance. We maintain that annually in the lab, the college lab. Remember, correct reagent preparations requires accurately weighed substances. So if your reagent that you're preparing has to be accurate, then that substance you're going to weigh on a balance has to be accurate. If there is an error in the balance that you are using, it means the chemical that you have measured is not accurate and the reagent that you're going to prepare in the lab will not be accurate. And sources of error. What are the possible errors? Inaccurate documentation of weighing scales, which means you calibrated to 2 grams, but actually it was 1 gram. If it is an analytical balance, it has to give the accurate measurement. If it is not 2 grams, if it gives 1.8 grams, it is a flaw. Inaccurate documentation could be possible. And inaccurate addition of weigh board and the substance. For example, if the weigh board is actually 2 grams and it shows 1.5 grams, on top of that you added the chemical. Now there are chances you're going to add more amount of the chemical, so it's inaccuracy. So it means it's going to be approximate, not the accurate. So all these things can be the possible sources of error. Inaccurate subtraction of weight. So if someone is weak in math, if they subtract with a different number, these are all human errors possible. So daily we have to be alert. Sometimes we can add one extra number, we can take out an extra number. Be careful, we are accountable. So be careful about all these things. And if we are spilling something on the pan, just don't tell your friend, can you please clean this, and then leave the lab. You stay there, it's your responsibility, you are accountable. If someone is asking, the next day the supervisor is asking, who did this work yesterday? And you have to come forward. Yes, I did that. Did you clean it? No, I told the XYZ friend of mine to clean it. Now, the supervisor is not going to ask the XYZ friend. They're going to bombard you. Why you told her? You can't say, I have to rush home. There'll be a big traffic. No excuse. Your job is your job. You're accountable. Okay? If you're really into some urgency, if you want to go to washroom badly and then you can't stay there, you can call a friend. Can you please take care? I'll come. But still you have to recheck or double check. You cannot depend. Don't make this types of mistakes in the lab. It's a big no, no, no. Pan, pan not thoroughly cleaned prior to weighing pan. So whenever you're going to do some measurement, make sure that's clean. Teacher, how to clean it? Miss, how to clean it? Take a tissue, first wipe it with dry, or you can wet the tissue, like wipe it, or use 70% isopropyl alcohol in case if you want to keep it clean without any virus and bacteria. That's even a good idea. Just clean it. Okay, because these are all metals. You can use a bleach for cleaning and then allow it to dry. Make sure everything is clean. Or you can use a chemical spatula. No, sorry. If you use a spatula to clean, then make sure that spatula is clean. What I would suggest, use 70% isopropyl alcohol and then wipe it and then just leave it for drying or allow it to dry, and then you can proceed with it. That's it. Now, my question, how many type of balances?
Three.
What are they?
Analytical,
Top loading, triple beam,
and the beam balance.
Okay.
Triple
Which
beam
balance is more mechanical and you can weigh up to only 1 decimal place?
Triple
beam balance.
Triple beam balance.
Okay, very good. What is the balancing of zero is called in any balance?
Top loading.
Tearing. Uploading is keeping on top. Loading is not even uploading. It's not a computer. It's just loading. You have to load it on top. Okay. And now, which balance can give a measurement of up to 2 to 3 decimal places?
That's the top
loading.
Very good. So which is a balance which is more accurate, more critical, more sensitive, expensive?
Analytical
balance. Like for how many decimal places you can weigh?
Four.
Four decimal places. Important
place.
questions regarding the balance. Important questions or these regarding the balances. Okay?
Okay.
Clear?
Yes, clear.
Yeah.
There.
Anything about the balance? So it's just a balance. When we go stand in the lab, we are seeing the balance. Zero, okay, put the thing, weigh, this takes only 10 minutes, but we have to waste 40 minutes of our time to learn this. Does it make sense? For us, it has to make sense because we have to just go through some of the information that we may not know. That's why to get more information, they have given this. Clear?
Yes.
It's an easy thing, right?
Yes.
No magic.
Yes.
Now, any questions?
No.
No, thank you.
Yes. Today, the class will be dismissed at 12:30 because there is a meeting. So you may be going at 12:25, but before that, we'll try to cover another topic, totally the pH and the refrigerators. I don't think it's possible for us to complete the pH with within the time frame of 12:30. So maybe tomorrow I will start with the refrigerator. So today I will cover the pH completely. The third topic that's been given will be covered by me tomorrow, all about refrigerators. And following the refrigerators, there'll be only the revision part, our question session, where we are going to just ask questions, making it clear for the test that you are going to take on Friday. Okay?
Okay, thank you.
Yes. Any questions? Amina?
I don't have any.
Okay.
Not for now, though.
Okay, so can we go to the other? So once again, for the exam, these type of questions from the balance and the pre-analytical specimen integrity chart, you have to know. And with the microscopes, I told you the color illumination is important. What is an illumination that is like used to give a uniform, what do you call, light on a specimen is called color illumination. What are the accessory elements associated with the color illumination is the iris diaphragm or the condenser. And how will you, what is the other name for magnification?
Resolution.
Resolution. How will you just calculate the magnification?
Magnification multiplied
Oculars.
objective.
Ocular,
and
the number of
objective.
ocular multiplied by the objective that you're using it, right? For example, the one for the bright field microscope in the lab, the eyepiece is going to be
10 times.
10x.
10x.
Very good. And the objective, what is the number for the low power field? 4x and 10x. 10x. And what are the numbers for high power field?
40x and 100x.
100x. Very good.
100x.
Very good. So which objective lens needs oil immersion or oil
100. 100x.
100. Very good. Okay. Tell me about the speed of light in air. Is it faster or slower?
Slow.
In air is faster.
Low.
It is very fast.
It's very fast.
In air, it's very fast.
Yes.
But in glass,
Slow.
Slow.
with an
On the
oil,
oil. Same
Slow.
as glass.
slow. Why we are able to get the clear image when we are using oil?
Because the oil slows down, refracts the light slower. It slows down the traveling of the light. The speed of light, yes.
So meanwhile, it gives everything to us, the details. That's the main thing. So do you think you have to clean the lenses after use?
Yes.
Yes.
Why?
It won't damage.
It won't damage
It's
the
easy to break
microscope.
down.
Yes.
Makes it opaque and ineffective.
Yeah, the next day the microscopic lenses will be capable so that we can use it again. That's the thing, right?
Yes.
So we are the one we are going to handle. So it's our duty. Cleaning is our job. Maintenance is our job. And the next question is, what do you use for cleaning?
70% ethyl alcohol.
In the lab, in the college lab. But generally speaking, what are the other things you can use? Can you use the paper towel?
No, don't scratch it.
No.
So there is a lens
Soft
paper
cloth.
available, right? Lens paper,
Yeah.
xylene.
Yeah.
Xylene paper is also
Yes.
xylene paper is also there. Xylene liquid can be dipped in cotton, as I told you. Some people are sensitive to xylene, so alcohol is the best choice that we made. Okay. And what is this lens of a microscope is made up of?
Quartz.
Quartz.
Quartz. What are the other like glasses that you know?
Silicon.
Silicon.
Pyrex, the borosilicate
Borosilicate.
quartz, and
Borosilicate or
the
Pyrex.
soda
Very good.
lime glass.
Soda lime glass. Okay, now another question. What makes the difference in the glass formation? What do you think?
Is
The
it the
composition.
thickness?
Chemical
The composition. Very good. So when you talk about the borosilicate, what is the chemical composition?
Pyro. Look at this.
When it is a borosilicate, which is also a Pyrex, right? The company which makes is the Pyrex. When we talk about the borosilicate, what is the composition of the glass?
Has boron.
Boron, very good. Boric
Has
oxide.
Boric.
Boric oxide and silicon dioxide.
Yes, silicon dioxide.
That's why borosilicate. Okay. Now, soda lime glass.
Silicon dioxide.
Mm.
Calcium, yeah.
Calcium oxide.
Calcium oxide.
Calcium oxide.
Calcium. That's for lime. Okay.
Silicon
Soda. Soda. We are having soda, lime.
Soda.
Sodium.
Soda lime.
Yeah, soda lime. So what is
Sodium.
the what is the chemical formula for soda? Sodium oxide, right? And calcium oxide. We talked about this. And silicon dioxide.
Silicon
Soda,
dioxide.
lime, gas. Lime is for calcium. You know that, right? Quick lime, we call that, yes. So soda is like sodium oxide, calcium oxide, and silicon dioxide. Now, what is this quartz? What is the composition?
Silicon dioxide.
Only silicon dioxide. That's why, who is expensive?
The quartz.
The quartz
is the expensive, right? Yeah. Oh, wow. We are dealing only with the expensive stuff. Right?
Yeah. High class.
So any questions? See you after the break at 11:20. 11:20.
Yes, ma'am. Thank you.
Because
see you after the break.
Yeah, 12:30 we are going today because there is a meeting for us. So any questions, please let me know. Okay. So today we'll cover the pH. Okay, drink a hot cup of coffee, and if your brain needs to be energized, come prepared because we are going to touch the chemical part today. That's the pH.
Okay. Thank you so much.
Yes. Have a nice break, guys. Thank you to have you guys.
Hello,
Louis,
ma'am. Can I have a minute, please? It's
Yes.
Ma'am, so tomorrow, we have an appointment in the U.S. consulate. I will be with my yes, ma'am. I will be with my husband, but I will be online for the whole time in my phone only.
Okay. If I see you here, then no problem. If you don't have to talk, no talking. If you can chat, you can chat, but your presence should be there. Okay.
Yes, ma'am. It's actually my husband appointment, but I need to be with him
I
to
understand.
take his
I
things.
understand. So that's not a problem. Okay.
Okay, thank you. Just to
Okay.
let
Enjoy
you
your
know.
break, guys. Enjoy your break.
Thank you.
Yeah.
Thank you.
You're most welcome. Have a nice break. See you again with lot of energy. Lots of energy.
We'll try, ma'am. Thank you.
Hello.
Hello.
Welcome back.
Hi.
Hi.
Hello.
Had a good break?
Yeah.
Yes.
Yes, thank you.
You're most welcome. So all of them are here. As I told you, we'll be stopping the class at 12:30. I have a meeting to attend. Today we are going to start with another topic, the lab equipments. Do you remember seeing the pH meters? How does it look like?
Yes.
Yes.
Yes, ma'am.
How many of you can say yes, we clearly remember? Some of them vague, like we saw something like a, you can explain. I want to know how many of you can recall what a pH meter is. We have seen this. I have explained this to you.
Yes, it showed us the meter is a rectangular boxy looking thing with the string, the cord.
With the indicator.
There's a probe.
There's a probe. Very good. Very good.
Yes.
Good, good. Which means, yes, we know something, right?
Yes.
Yeah. It's a good job that you recall this. It's a very important part. It's a very important lab equipment. But when you come to the other labs, manually, no one checks the pH now. It's all done by the analyzers. The analyzers check the pH. Right? No one has time to play. But we should know how to calibrate a pH meter and how to test if it comes to the manual evaluation. But generally, these type of jobs is done by the MLTs. They will check. We have to prepare everything and keep it ready. But the pH meter to perform on an urine to check the pH or any other reagent is usually done by the MLTs. But we have to keep the setup ready. Mainly when it comes to the specimen, the MLT has to give the result. But we should know how to operate, how to set up the table. And once again, I'm repeating, majority of the pH is not tested by the technicians. The analyzers and the machines do the job. Now, we'll begin. This learning material is the property of Anderson College. So we all know that the reference book that you have to use is Chapter 8, 8th edition by Mary Turgeon. She's the author. Do you have books, all of you, to refer?
No.
How many of you know? Yesterday someone said yes. That's for the phlebotomy?
Yes, that's the one that they
only
gave us.
the phlebotomy.
Only for the okay, so you have it for the phlebotomy.
Yeah.
But not for these things. Yeah, but these slides, they give a very good information. So you don't have to worry about it. Just I'm asking.
Yes.
Now, pH definition. How will you define a pH? As the name indicates, we are focusing mainly on the H stands for the symbol for the hydrogen. So it's mainly the hydrogen ion concentration that we are looking for in a solution. This plus or minus sign is the ion. So when it becomes a molecule, for example, the water molecule H2O, it means you don't have to show these ions with the symbol plus or minus. You should know. So when it becomes a molecule, the ions, the plus and minus sign won't be there. When the molecule dissociates into ions like a plus and a minus charge, then we should focus mainly on the hydrogen ion concentration when we talk about the pH. pH is a measure of hydrogen ion concentration of a solution. It can be a water solution. pH is an indication of the acidity and alkalinity of a solution, which means when you take the water molecule stands with the formula H2O. It is balanced, the ions are there. But when it is dissociating, it will dissociate as hydrogen ions H plus and OH minus. So together it becomes H2O. So when it is dissociating, the more the hydrogen ions are in a water molecule, collectively in the water, it will show the acidity. The more the hydroxyl ions are dissociated, it will show the alkalinity. For example, we are not talking about the single water molecule. We are having a beaker of water, for example. It has so many water molecules. But the way it is dissociating is leading to the alkalinity and acidity. In a solution, generally with some other chemical, if more hydrogen ions are released, what will be the nature of this solution?
A base, right?
If you have acidity, if you have more hydrogen ions in a solution, it is guaranteed acidity. If you have more hydroxyl ions, it is
Alkaline.
Alkalinity. So this is the bottom line. This is the bottom line of a pH. We are going to see a little bit more in detail because even in the body, our body goes through different metabolic changes. So we will come across the pH in the stomach, whether it's acidic or more basic. In the urine, if you even collect the urine, we check for the pH if it's more acidic urine or alkaline urine based on the nutrition, based on the condition of the metabolic disorders, based on the condition of what we are consuming, medications we are taking, or any disease condition. So everything is associated with the pH. So we have to know about the pH of our system as well. Normally speaking, outside in the lab setup, a tap water, any water, when we call the water, it's collectively water molecule associated with both the hydrogen and hydroxyl ions together. That has to have a neutral pH, which means pure water. Can you see this blue color here, which says 7? It means the hydrogen ions and hydroxyl ions have combined to make the water molecules. So this water molecules collectively makes the pure water. But when you go to the urine, as given as an example of urine or saliva, it's 6, which means it will have a little bit more of what? Which ions?
Hydrogen
ions. So when you talk about the black coffee, more of
Hydrogen.
Hydrogen.
Acid rain. What is this acid rain? Where will we combine or come across this acid rain?
Usually around volcanoes.
Usually around volcano. Okay.
Could be.
Then any other chances?
Yeah.
Of acid rain? I'll give you an example. So the carbon dioxide, the gases, the nitrogen peroxide or nitrous oxide or sulfur dioxides that's been coming out of the burning of the fuels, it will be accumulated in the cloud. And when it is like condensed and when there is a downpour, there'll be chemical reactions where more of the hydrogen ions are combined there when it's coming down as acid. So this is what we call the acid rain. So all this GE6 summit, that summit, this summit to reduce the fuel, to reduce the, the vehicles, because we don't want the fuel emission to affect globally. All these things is because of this acid rain. It is affecting the human population and also the plants. Many plants, they cannot take the acidity of the soil, so they are dying. They are close to extinction. And these plants can be for our consumable products as well. So the producers that's coming from these plants, we are not getting anymore to that extent because of the acid rain. So the contribution of the acid rain is because of the chemicals that is in the environment, which is going up, and then it's making the atmosphere more acidic. It's not good for us either. It should be pure. And what about the juice, the orange juice?
Acidic.
Lemon juice, vinegar. What is the chemical term for vinegar? The common name is vinegar. The chemical name for vinegar?
It's
acetic acid.
Acetic acid. Very good. Acetic acid.
Yes.
And then this one, HCl in stomach, is highly
acidic.
If you get a question, which acid is in the stomach?
Hydrochloric.
It's highly acidic? Yes.
Yes.
Right? So we have acid in our stomach. How we balance that?
By drinking
What's that?
water.
More water?
Nutrients, usually the nutrients that we take, we consume, it balances. It won't allow us to burn, but of course we have to take care. The system itself is made in that way that all the nutrients that we take, the chemicals that combine, it balances. What if you're not consuming the proper nutrients or vitamins that has to perform the metabolic reactions in a proper way? We get the acidity in the stomach. Stress is another thing that develop more acid in the stomach, acidity, and people get acid reflux due to so many reasons. Drinking lots of black coffee is one reason for acid reflux, where you burp, there's a burning sensation, all these things. So if you go in detail, it's like a big, huge topic. So we'll stop with this. And the acids in the batteries, what about that?
And so highly corrosive.
Highly acidic. When you come to this side of the scale, starting after the pure water, it has more hydroxyl ions. What does it mean?
Alkaline.
Alkaline. So seawater?
Alkaline.
Alkaline.
Yes, alkaline.
What? Because
That's
why
salty.
it's alkaline? Because it has the salt, sodium hydroxide. Sorry, sodium chloride. But anyways, this chloride ions, when they mix with this, then hydroxyl ions are eliminated. So seawater is more alkaline. Baking soda?
Alkaline.
Alkaline. Ammonia?
Alkaline.
Alkaline. Soapy water?
Alkaline.
Bleach that we prepare? Alkaline. And then the drain cleaner? Alkaline. So this you have to know as a basic scale. So what do you understand from this? The pH scale starts from 0 to 14, the neutral being the 7. The more numbers towards the, I can't say the more numbers, the numbers towards the lower side of the scale, starting from 0 until 7 is usually acidic. The numbers higher than the 7 up to 14?
Alkaline.
Basic.
Alkaline. Yes, very good. Or the basic. So we talked about it. The pH scale is 0 to 14. pH 7 is neutral. The concentration of hydrogen and the hydroxyl, they mix together to combine, to balance, to form a water molecule. This is what we call the neutralization. The neutral is pH 7. So if you get a question, what is the neutral pH?
7.
Example. Water. Acidic pH. An acidic pH occurs when you have, as I told you, hydrogen ions in excess compared to that of hydroxyl. How acidic is determined by how great is the excess. So it's all up to the hydrogen ions that are freely there available. So pH values below 7 are acidic. The lower the pH reading, the more acidic. We know this. Alkaline. An alkaline or basic pH occurs when you have more hydroxyl ions or extra hydroxyl ions. How alkaline is determined by how great the excess hydroxyl ions are there in the solution. A 7 and above are considered alkaline. The next one, example of acid is given. This is easy to recall. Lemon juice, vinegar, hydrochloric acid. Do you think you have only hydrochloric acid in the stomach? Can you find hydrochloric acid in the lab?
Yes.
External? Yes. How many of you yes? How many of you know?
Hydrochloric acid is a common acid that they use in chemistry. So yes.
Yes. When you go to chemistry department, you have all kinds of acids. Yes, it is available. And while handling this acid with water, which should be added first?
Acid to water.
Acid to water.
Right.
Very good. Very good. But there will be a question in the ML POW. So how will you add acid to water? No, which one you have to add with what? You cannot say water has to be added to acid. You have to say
acid to water.
Acid to water. Why?
Yeah.
Why?
Because it is going to give a very corrosive reaction, and to avoid that splashing.
Like the explosive reaction, yes. Right. All of a sudden, yes. Examples of alkaline solutions, baking soda.
Yeah.
How many of you know how to bake? How many of you are kitchen people?
I can bake.
Me.
So baking people,
We can bake.
you should know baking soda is alkaline. Sodium hydroxide, potassium hydroxide, all these things. These are all chemicals. Where will you find the information about the chemicals that you're going to use in the lab?
SDS.
Are you sure?
SDS.
Are you sure?
Yeah.
Yes.
Yes.
Yes, and on the labels, the labels of the products.
Yes, the labels.
Yes, the
Yeah,
labels.
but more information about how to store, how to handle.
On the
SDS.
SDS.
Storing, handling, and
SDS. We
product
talked about it.
Yeah.
So you all know, right? Now, what is a pH meter actually? Talking about the pH meter, what is it? What is a meter?
Electric device.
It's an instrument.
It's a device. Good. It's a
Device.
device to
or
measure
instrument.
something.
Yes.
Spectrophotometer. It means light
Measure light.
It's
measured, right?
fluid
And then
and-
pH meter, measuring the pH, right?
Yes.
So glucometer.
glucose.
Measures the glucose.
Very good. Very good. So how will you measure the pH? To measure the pH, we studied in a different way. We never had this pH meters. We use the papers. We call the litmus paper.
Yeah.
Based on the color change, we come to conclusion, oh, this is acid. This is base. We have to dip it in the solution and look for the color change, and we have to document it. But now we are lucky to have this devices, the pH meters. And this accurate pH readings are measured using this. How and why they are accurate? Because it has a probe. The probe has a glass bulb. See the bubble, actually. It's not a bulb. It's like a small bulb-like thing. It's a bubble. And there is an internal solution. But this is a black in color. We have seen it in the lab. It's like a black in color because it's like, it's made in such a way that we are not seeing anything clearly inside. What's happening? We can only see the glass bubble. We have seen the glass bubble. But we do know that there is, from the outside, there is one more wire attached to the pH meter, right? And this wire is actually made up of AgCl. What does AgCl stands for?
Silver chloride.
Silver chloride. Ag is a symbol for silver. So silver chloride covered, basically it's a silver wire. And the electrical charge that's been generated when you put the glass bubble in a solution, which will generate an electric current, and that is passed through the internal solution, and that is continued by the silver wire. It picks up the voltage. It's very minute voltage or electric current, which is in millivolt, and that is connected to the interference rod that's present inside the, or interference probe that's present inside the pH meter, and that voltage is actually converted into the level of pH. That's how the pH meters are generally designed. So we're going to talk about more, and the types, more types of pH meter we're going to talk. So the probe has a glass bulb. We know this, and electric wire. Now we know. The wire sends data to the meter, but the glass bulb is dipped into the solution. Yes, we know this. Now, what is the principle behind? I just give you a vague explanation. So we're going to see in details how it is actually happening. The pH meter senses differences in the electrical charges between the inside of the glass bulb and outside of the glass bulb. So we are just differentiating now. There is an environment or environment surrounding the glass bulb and the internal environment of the glass bulb. So the differences in this will create an electric voltage. That's what we are talking about. So the electric charges outside of the glass bulb are related to the concentration of hydrogen ions and hydroxyl ions in the solution. So if you're putting this electrode in an acidic solution, now the glass bulb will be sensing more of the hydrogen or hydroxyl ions. It depends. If it is acidic, what type of ions will it's going to like sense?
Hydrogen,
because it's acidic. Yeah. If it is like an alkaline,
hydroxyl.
If it is a tap water,
It's going to be neutral.
Neutral. No charges will be just coming from inside. So this difference in charges between the outside and inner surfaces of the glass is called electrical potential. Now, when you get a question, it's important. This bold lettered electrical potential is important. So what is generated when you put the glass bulb in a solution where you have to check for acidity or alkalinity? What is that called?
Electrical potential.
Electrical potential. So you should know this definition. Keep this in mind and just go and study about the electrical potential, the definition for electrical potential. The difference in charges between inside and outside surfaces of the glass is called electrical potential. Okay. Now, the voltage or electrical pressure created by the electrical differences between the outside and the inside glasses, mainly because of the hydrogen ions to flow across the glass, and the current is generated and it flows to the wire. What is the nature of the current? It's like a high voltage or very negligible voltage.
That is minute.
It's very minute. So we call this millivolts. So the current generated is very small and the voltage is cannot be directly measured. So there should be some alteration, a minute alteration in the device. It can sense very minute electrical impulses. That's the reason for the invention of the pH meter. The pH meter, they manipulate the whatever they are sensing and they are converting it into the reading as a reading of a pH, and that is displayed on a small screen, the display screen. Okay. So the measuring electrode is connected through the meter to a reference electrode. This is what I talked about. The reference electrodes in the previous pH meters were different. One, we have this with the, what do you call, the bulb one has an electrode, and the reference electrode in the oldest machines are inbuilt within the pH meter. But now we have 2-in-1. The same electrodes is combined with the reference electrode and the monitoring electrode. The one we have in the lab is like that. In the previous pH meters, we had 2 electrodes. One is the built-in electrodes, and that sometimes is seen in the form of a rod. But now we don't have 2 rods. We have only single rods, reference electrode with the monitoring electrode. Whatever we are going to measure for the pH, both are 2-in-1. So automatically the electrical impulses are generated and only we see the reading. So we have the advanced one, thank God. So the measuring electrode is connected to the meter, yes. Otherwise, Miss, what is this? Where to put? You put it in the solution. Miss, what is this? There's a reference electrode. So all these things, it depends on the different type of equipments we have in the lab. The one we have has 2-in-1. So here the measuring electrode is connected through the meter to a reference electrode. This is what I'm talking about. The reference electrode, depending on the pH meter, we have different. Where you are being hired, if you have a pH meter, have a look. Read the instructions of the manual, how to use it. If you have questions, if you have a doubt, ask your MLT or a supervisor or your coworker. If you get an advanced pH meter, it's well and good. The one we have in the lab is advanced, so you don't have to worry. Only one electrode, you dip it and you press the button, look for the reading. That's the good one. So the reference electrode has a stable measurable reference voltage, which is only affected by the current coming from the measuring electrode. So this inbuilt reference electrode in the pH meter is very sensitive. Even the small electrical impulse that is sensed by the measuring electrode is actually captured by the reference electrode, and then now it has to verify the millivolts and convert it into a pH, and we will see that in the display screen. Clear?
Yeah.
This is what I'm talking about. So we don't have this type of thing where you have to lift it, you hold it. We don't have this headache. The resultant fluctuation in the voltage of a reference electrode is what is actually measured. I talked to you about it. This fluctuation or the reference of the voltage that's been generated, which has been sensed by the reference electrode, now has to transmit it in the form of a pH reading. And that's what we see on this small display. monitor. Can you see this? So we are not seeing the voltage. We are not seeing 0.2 millivolt. We are seeing it in the form of a reading of a pH. That's the principle of the pH meter. Clear?
Yeah.
Okay.
Yes.
The change of voltage in the reference electrode is measured in millivolts and relates back to the number of excess hydrogen or hydroxyl ion present in the test solution and is converted into a pH reading. That's what I talked about. This is one type of pH meter. We don't have this. Now, any questions? Or I will ask you questions. How many types of electrodes are there in a pH meter?
2.
What are they?
Reference electrode and one is the reference electrode and the
one
other
is reference, the other is
reference. Can't remember.
Measuring electrode.
The measuring.
Right? You can even code this as MR. MR means measuring electrode and reference electrode. MR for pH meter, measuring electrode, reference electrode. Right? Yeah, the one we have in the lab is 2-in-1, I said. What does it mean?
The measuring electrode and the reference are together in one.
So automatically, whatever the changes in the voltage is been instantly, it's there, it converts and send it in the form of electrical impulse to the pH meter, and then it is converted. In previous old pH meters, the reference electrode was different and the measuring electrode was different. And some pH meters have built-in reference electrode, but the one we are using has 2-in-1 combined. I told you, because it's an advanced one. Thank God. Now, how will you calculate the pH? Any questions about the pH meter? Now, what is a pH meter? I'm not going to leave you until you don't answer, each and every one.
It's a device for measuring hydrogen and the acidity.
Hydrogen and acidity.
Alkaline and acidity.
Alkaline, very good. Hydroxyl and hydrogen. Very good. Good job. You know that. Now, what is it called? The question we talked about, the electrical potential that's been converted. What is the term that we see that we have seen that in the slide? What is electrical potential?
Okay. Yeah, electrical potential
difference
between the outside and
changes.
Bulb in the charges. Yeah, that the bulb.
Yeah, the voltage that's been transmitted.
Difference in the changes, between outside and inside.
Very good. Outside the bulb, inside the bulb. When you dip it, the electrical impulses that's been picked up and that's been carried to the reference electrode is what we call the electrical potential. Don't forget this. Okay. Now, how will you calculate the formula? Wow, Miss, what is this? We are learning math? Yes, you're learning math. So even in the math, there is a module, lab math. You will be dealing with the pH meter. So make sure if you have any questions, you clarify that with regard to the pH meter, okay? Now the formula used to calculate the pH is negative log to the power of hydrogen ion concentration. What does it mean? Why you make our life so complicated? We are peacefully living, right? Without math.
My God.
Yeah, right.
Math is in our, see, I know you, what you're thinking. Why all this, Miss, we have done with it, but you're still in the lab, you're going to work in future, so you have, daily we're dealing with math. Yes or no?
Yes.
I am dealing with math daily. I have to take the attendance. How many people here? 21, okay, 20 or 19, 17, missing 3.
Simple
That's
math, not
simple math.
log.
So what is this hydrogen ion, negative log to the hydrogen ion concentration, which means if you have to calculate more numbers, something associated with more numbers, we use the term logarithm in math. So what is this logarithm? Logarithm is something with a base, and we have the exponent as the power. And for this one, simply you have to change the exponent to get the numbers. Right? For example, if you have to calculate like 100,000, instead of writing 1 by 10 into 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 1 by 10 or something like that, 1 by, for example, 1 by 100,000, instead of writing 1 by 10, 1 by 10, 1 by 10, 1 by 10, you simply put it in the form of a base 10 to the numbers at the top. But since it's 1 by, you have to put it negative. That's what the logarithm type of math is. Okay, we'll see it with an example. If I say the hydrogen ions as I told you negative logarithm, which means it's definitely there is an exponent and there's a base 10. So when we talk about the negative logarithm, is for example 10 to the power minus 2. How will you write 10 to the power minus 2 in fraction? What do you understand by 10 to the power minus 2? Basic math, guys.
Nothing.
What is 10 to the power 2? 10 to the power 2 means 10 times 10.
To 2. Yeah, 10 times 2. Yeah.
10 to the power simply 2 means 10 times 10. 10 to the power minus 2 means put a now 1 at the top and 10 at the bottom. Yeah. That's 10 to the power minus 2. So 1 by 10 into 1 by 10. If I simply say 10 to the power minus 2, 10 times 10. So it's a negative logarithm, so which means 10 to the power minus 2, 1 by 10 times 1 by 10. So 1 by 100. Yes? No?
Yes.
That minus,
yes.
that minus
10
thing,
times
that
10.
negative thing is confusing me. I know that, okay, 10 raised to power 2 is 10 times 10. So how do you now work with minus? Minus? It's like
Miss,
that.
I'm a little confused too, because I'm used to seeing 10 to the power of 2, and then you know it's 10 times 10, but the minus
so
is a little...
here we are usually using this as a base. The number 10 is a base.
Okay.
This we will use for the pH, wherever you go. For the pH, there is a base, the base is 10. Okay, because we are associating with the numbers in the decimal when it real sense when we talk about the pH scale. But when we write it in the formula, this is the formula that you have to memorize. Even the definition says the negative logarithm to the base 10, which means when I'm giving the number as 10 to the power minus 2, how will you convert this in the pH? The pH is 2 because the negative logarithm here means minus times minus. You take the thing out of the bracket, minus times
Plus.
minus is plus, so
Yes.
plus 2. This is
So
how
the
you have to
negative
memorize.
cancels out.
Yeah, cancels out.
Okay.
So here the hydrogen ion how much hydrogen ion concentration is there in the solution? We are having 0.01 moles per liter. Now,
And that's a
this
constant
unit
value.
is, this
It's
is
a
the
constant value,
concentration
ma'am?
of, yes, L is the volume, yes. In 1 liter, this amount of acidity you're having based on the hydrogen ion concentration.
It's asking if that is a constant, but I think this is an example of the calculation.
Example, yes, example.
Okay.
It's not a constant.
Okay.
This is an example I'm giving. So if I'm putting the number as minus 6, calculate. How many zeros, how many decimal points you have to put the point here, like after how many zeros? If I'm writing the number, because this is acidic, right? We're talking about the hydrogen ions, which means we're talking about the acids. This is how you calculate for acids. If I am writing like how far the acidic nature is of a solution, of 1 liter solution, how will you calculate the hydrogen ions? If I'm giving the number minus 6, it becomes plus 6. Yes?
Yes.
Where will you keep the decimal point? After how many zeros?
1.
How many zeros will be followed by the decimal? Let me put it in this way.
5.
5 0.
5 zeros. 5 zeros.
Yeah.
Got it? So this, when you come to lab math, when you work about this one, then you will have a clear idea. But right now have a basic idea. We are going to calculate the acidity and alkalinity based on the base 10 to the power, what we are going to use. Okay?
Yes.
And what is the unit for the pH? Moles per liter. What is the unit for the pH?
Moles per liter.
Measurement, moles per liter. What does this indicate? Moles per liter means in 1 liter of the solution, 0.01 mole of that hydrogen ions are present. Okay? Clear?
It will take some time to get used to all this.
Yeah,
Yes.
it will take some time.
Not
Yes.
completely clear, but we are working on it.
When you do the lab math, then you will be more, you'll get more idea about it. Okay?
Yes, I think the more we do it, Miss, we'll get better at it.
Yes. So now, when I'm telling you this, the number is 10 to the power minus 1, then it becomes plus 1. So it's 0.1 moles per liter, so which means 1 by 10. But always the pH is calculated in the form of a logarithmic scale, which means it's that there will be a base followed by the exponent, which is at the top. When it is a negative, it means it's towards the acidity where you get the positive results. And then based on the zeros, how you're going to put the decimals followed by the zeros, you calculate the acidity and alkalinity. If you get a number which says 0. Followed by 12 0, then a number, it means the solution is
pH is
6. No?
I told you 12 zeros. When you have 12 zeros followed by a decimal, is the solution acidic or alkaline?
Okay, that should be alkaline.
Alkaline, because the number is going towards 14, right? So the lesser the number or the lesser the zero, are more
acidic.
Yes. Clear? Yeah, this is just a fundamental thing that you have to know about the pH. The definition itself, it goes, it's a negative log to the, negative logarithm of the base 10 to the power of exponent. And the number denotes the alkalinity or acidity. The lesser the number towards acid, the more the number towards alkalinity. Clear?
Yes.
Yes, that one is clear, ma'am.
Exactly, that one
Very clear.
That, yeah. For now, the time being, keep this in mind, right? Now you may ask a question. You're not going to ask. I will ask. You may ask a question. Why miss this? The base 10 and then the exponent at the top, and then we have to expand. We have to calculate, because I told you when you want to calculate with the larger numbers, instead of writing this 10 times 10 times 10 times 10 times or 1 by 10, 1 by 10, 1 by 10, 1 by 10, they just give a base. And whatever number you have to insert at the top to get the answer, that's easy for you. So once when you calculate, when you are going to learn the lab math in future, you will know about it. It's going to be easy. Clear? Somewhat clear?
Somewhat
clear. So based on the numbers, numbers and the decimals. Yes, very good. Now, what is a pH scale? It's logarithmic. I said logarithm, which means it has a base with an exponent that you can expand anytime to get the result. So a change of 1 unit on the pH scale represents a 10-fold change. That's what it means. I told you when we have to calculate for larger numbers to give the answer, then this is how we use it. So a change of 1 power or exponent of 10 means it's going to be 10-fold. I'll give you the example now. We're going to see it. pH 2 means 0.01 moles per liter of hydrogen ion concentration, which is acidic solution. pH 1 is 0.1 mole per liter of hydrogen ion concentration. Again, it's going to be acidic. But the difference between the pH of 1 and 2 is going to be like this. So the pH scale is, I told you, we call this logarithmic scale because there's going to be a difference of 10 every time. Difference of 1 power or exponent of 10. That's what it means. Means 10-fold. 10-fold difference. 10-fold difference. Every time when you increase the acidity, then there's going to be a 10-fold difference. For example, this is how it is. If I pick an acid which is in the range of 3, which means it's pretty much acidic, right? It's acidic. Now, this 3 is 10 times more acidic than 4, but 100 times more acidic than 5. So based on the base 10, see how beautifully we are calculating. This is the reason to avoid the confusion. We kept the base 10 as a uniform category where you can put the number and then you can extend it with a number. So you can calculate for the large numbers. 10 times more acidic than 4, 100 times more acidic than 5, 1,000 times more acidic than 6, 10,000 times more acidic than a pH 7, and 100,000 times more acidic than a pH 8. So this is how we calculate. So this comes by practice, but know the fundamental thing, why we use the logarithm. Logarithm is something that we introduce in math with a base to the exponent added, so that every time when we want to increase, we have to simply elaborate the formula and then we will get the result. For example, this is the best example. 10 times more acidic than 4, right? When you just increase the scale, every time the tenfold number is going to increase. That much acidic it is. Even though we say pH 3, pH 4, it's not the differences with the one number acidity. It's tenfold acidity every time when you increase. Clear?
Yes.
Is this part clear? This gives a picture of why we picked the base 10 and why we have to put the number at the top.
Yes, this part is kind of clear, but how to now apply it consistently is where, like,
that once when you calculate with the formula, we're going to do that in lab math. You'll be learning. So in that, you will know how to pick the acidity number, the alkaline number, where to place the decimal, and how many zeros you have to put based on the number after the decimal. These things will be more clear. So we are not going to break our head for today. Today, this is enough. If you know negative logarithm to the base 10, you know pH. If you know what is a pH, what we are measuring, what is creating the number difference in the display, you're good in pH meter. If you know what an electrical potential is, you're good to know the pH or the pH meter. Clear?
Yeah.
Yes.
Yes.
Now, one more question. You're not going to ask, I'm asking. Why, miss, we have to study about the acid and the alkalinity? Why? Why we have to just study about all these things?
Because during testing, we need to know that as like when we are working in the lab, we work with chemicals, so we need to know how to determine which is which, so that to avoid accidents.
Very good.
During testing too, I think because like we have our internal environment, like the humans that we are dealing with their samples, so we need to understand because it also affects their results, I think, so that we can know what we are dealing with.
Yes, very good. While cleaning, while making reagents, we should know which one is acid, which one is a base, right? And how we determine. And also, I told you in our system, we have HCl in our stomach. I told you, it means we are acidic also, right? We are born acidic in the stomach, but we have to balance. And mainly while testing the specimen, it's a good point. So when I'm working in the urinalysis department, I should know the urine when it comes. If it's more acidic, it's not good. Something is wrong with the system, right? So maybe it's due to nutrients, it could be due to medications, it could be due to some illnesses that's inside a disease condition. So the pH determines what is actually happening. So it has to be tested further. The doctor has to go through in detail. The physician should know what's happening with the system. So for all these things, we have to know about the pH. Mainly when dealing with the pH, yes, mainly with the UTIs also, the urinary tract infections, they will check for the pH, the acidic pH, the alkaline pH, and everything, right? Because they have to start with the treatment, and the treatment has to like balanced. So the urine has to be, yes, it shouldn't be too acidic. It's no good. So
yeah, that's what I was
know.
going to say, Miss. Miss. That's what I was going to say. Isn't it have to do with the balancing? Like if the acid, if it's too acid or too alkaline, then you got to balance it.
Balance it. Yeah.
Yeah.
But
so
what is the nature of the urine? It's slightly acidic. It has to be, or alkaline. It has to be. It has to be alkaline or acidic.
Slightly acidic.
Slightly acidic. Okay. Yeah. Good. So do you know like what leads to the alkalinity of the urine? How will you balance?
Yes.
If I'm testing an urine sample, I'm getting pH 12 as an, then what is it? Let's acid or alkaline? Alkaline. Alkaline. So what could lead to that alkalinity?
It could be
too much water.
Vegetables, the diet.
The nutrients.
Diet, nutrients. Very good. Vegetable diet leads to more alkalinity.
Right.
But is that not good to
You're
have?
drinking a big cup of black coffee and then you pee and then you take the urine and then you give that for sample. What will be the situation? What will be the nature of the more acidic? You should know this, yes. So if there is already a person is having acidity issues, so if he's drinking one big large cup of coffee, is it good for him?
No.
No.
Leads to more problems, right? So that's the reason we should know about the pH. So the bottom line is it's about, we are learning about us.
Exactly.
Than the chemicals itself.
Homeostasis.
So people who are black coffee people, please check your stomach acidity levels before you drink. Okay. Now, Joanna. Is Joanna there? I want to know why she left. She's not here in the class. Maybe she's having internet issues. Can anyone message her? Let her join again. So now pH is inversely related to hydrogen ion concentration because pH is a negative log of, again and again, we are talking about the formula, how we calculate. Okay. If the pH is 0, it means 1 mole per liter of hydrogen ion concentration. All it has to do with the numbers, playing with the numbers for the pH. The current pH meters, they combine the glass measuring electrode and the reference. See, I told you, this is the one that we are having in the lab. The glass measuring electrode and the reference electrode in one probe. It is covered with a black some strap, and then this is what we use in our lab. The one we have is this one. Thank God we have an advanced. pH is temperature dependent. So some models, so depending on the model also, they have an additional temperature sensing probe. So the meter can automatically correct for temperature. So in some pH meters, there is a temperature that it picks the temperature for display and then it gives us a result. But we are concerned about the pH. Now, see, these are the types of pH meters. We have this one. Directly, you have to put the probe inside. It's built 2-in-1. And this one, can you see this with 2 different electrodes? The middle ones, 2 electrodes, one is in the solution, the other one is that side. This is what we talked about before, the reference electrode and the measuring electrodes. You can have a pH meter like this, but it's a very old one. And this is the one that we have again, the one at the back, the one in front in the solution. We don't have two probes, and we don't have the two wires extending. We have only one wire extending, and that goes into the solution, which means what?
Which means, what is the question, ma'am?
Well, the question is, we have only one electrode. What does it mean?
It's 2-in-1. It has both the measuring and reference electrode in one.
Very good. This is what I'm expecting, okay, from you. Because when you come to the lab, I'll ask you questions. Now, pH adjustment. If checking the pH of solutions, this is important, I'm telling you. If you are given an agar media, now you might ask, what is an agar media? The agar media is nothing, a media that we use for the microbiology to check for the pH, because you know the pH is, the microorganisms are also sensitive to the pH things. Some can grow in acidic pH, some can grow in the alkaline pH, but normally the microorganisms, the bacteria, they prefer the normal pH. Okay, if in case we want to prepare a media, and when we're preparing the media, just we have what do you call acidic. We have the pH, very low pH. We made the pH to be normal, but somehow we made the acidic pH. How to balance that? When it's more acidic, put few drops of alkaline solution, that's a sodium hydroxide. You can balance. Okay? And you are preparing the agar media where accidentally you made it more alkaline. What will you do?
Drop by drop acid.
Few drops of acid. The best.
Acid.
Yes, acid to balance or to make it neutral. But here, look at the examples. If I ask you a question, give an example for an alkaline solution.
Baking soda and water.
Baking soda. Here in this slide, the example is given. What is that?
Sodium hydroxide.
Sodium hydroxide, baking soda, potassium hydroxides. All the hydroxides have hydroxyl ions, which are alkaline. Okay, I'm asking you, give examples for acidity or acid solutions.
Hydrochloric acid.
Hydrochloric acid.
Acetic acid.
Acetic acid. Citric acid. Very good. All the names acid, sulfuric acid, nitric acid, and then
acid.
Yeah, all the acids, the name is there, you put it. But the simple alkaline, the simple acid examples are sodium hydroxide for alkalinity and hydrochloric acid and acetic acid for
acidity.
Acidity. The name is there. Right?
Yes.
So how will you estimate the pH? This is the primitive method. We used to do this a lot. You need immense patience for this. You just use the litmus, we call that litmus paper, a specific paper made to check the acidity or alkalinity, right, in a solution. There'll be small strips of rectangular paper. We have to just pull one paper and we have to dip it in the solution to observe what color it is changing now. And then you are not playing like that. Even though we have the paper to check in the lab, we are not, thank God, we are not doing those things. We don't have patience to do those things, but I can show it to you. How will you identify it is like a pH paper? I'm explaining the way I learned. If the paper is turning red, it is
Acid.
Acid.
No, it's acid.
Acid. If the paper is turning blue,
It's alkaline.
Neutral.
Alkaline or base?
Or base.
If there is no color change.
Neutral.
Neutral.
Okay.
So how I remembered, I usually make words like, as I said, MR for the pH meter, measuring electrodes, reference electrodes, MR, right? The same way I made this, the end red D is for acid D, DD. If it is red, it is acid because the last letter is D and it should be an acid D, right? And if it is alkaline or base, what is the color change?
Blue.
Blue ends with the letter
E.
Because sometimes during we had practical exams and all those in the chemistry department. After learning so many details, it's very hard to remember this. Now, even when we are entering inside the lab, then we ask our friend, oh, do you know what is the color change? Do you know what happens? Sometimes we mix up with all those things. So this is how I learn. I always make the combination letters of the words as an acronym or something, and then I keep it in my mind and I'm free. I don't have to memorize. Yes.
Is neutral more of a green color though? Like when you're using the strips, like the pH strips. Isn't it supposed to be more?
I don't think so. When we used a pink one. So I don't know. It's depending on the manufacturers. It has a standard color.
Okay.
But usually light pink is the one that we used to have. So when it's becoming red, I don't have to worry about any inputting of information. Simple. DD done. EE done.
Okay.
Right? Yeah, I will give you this tip seriously. So this is how I learned. When you are learning, even for this, make some words like that. You will see how the burden will be less on you.
Yes.
Yes. Then pH papers are treated with pH indicator solutions and dried. That's one estimate. And we call the pH indicator strips, basically. So dip the pH paper in test solution. Paper will turn different colors based on the pH of the test solution. So it all depends on the manufacturer, the color. And there will be a comparison chart for the nature of acidity and the nature of alkalinity, how alkaline it is, or how acidic it is. Based on the color change, you are going to compare that. I told you we are no longer playing with the pH in the lab, the real sense. Everything is done by machines. But as a technician, you should know the fundamental aspect of a pH. Clear? And color is compared to a color chart to determine the pH. Okay? Now, pH safety. Now, what you have to do while checking the pH? What are the possibilities of getting injured or getting allergies or something like this? What will you do or what can you do? So can you use bare hands?
Yes, PPE.
PPE, very good. So it means you have to wear the PPE. What is the PPE that you're going to use? Because you're going to deal with chemicals. So
eye protector or the eye shields.
Gloves.
Gowns.
Gowns.
Gloves.
Goggles. Sometimes face shields.
Yeah, face shields.
And face mask too.
Face mask.
Yes, face mask.
Why face mask?
Some chemicals
you cannot inhale.
You don't have to inhale some chemicals or fumes.
Chemicals.
Yes. And most of the time when mixing with the acid or alkaline with any other solution, where will you perform this?
In the cabinet. Safety
Which cabinet? Safety cabinet. Or mainly it's a chemical. So
chemical cabinet.
Fume hoods.
Fume hoods.
Fume hoods. There'll be a question, guys. Biological safety cabinet. Yes, of course you can do. You can turn on the exhaust, but it's more safer to be in a fume hood. As the name indicates, the fumes will be absorbed. As the name indicates, biological safety cabinet is for microorganisms to be sucked.
Okay.
So more specifically, if it is a chemical, it has to be where?
Fume hood.
Fume hood. Good job. And if there is any, why? Because we are dealing with the corrosive chemicals, acid or bases. So there may be some accidents related to skin, eyes, breathing passages. That's why mask, everything you have to protect yourself. But you're not going to deal with more serious chemicals because we are not here working mostly with the chemicals. It's just some fundamental things we're going to use because we are not the students of a chemical lab or chemistry department. Okay, they have to deal a lot with different chemicals. And spills must be wiped up immediately. Why?
To avoid the corrosive reaction
to the skin if someone accidentally touches it, right? So we have to avoid it. We have to neutralize first. We have learned it in the chemical spill, what we do. Remember? So disconnect the pH meter from power source before repair. When you want to do something, you want to experiment with the pH meter, if there is any power source connected, you just take it out, unplug all the devices for all the equipments. If you want to check something, first unplug. But the one we have is a battery operated one. Okay. Now the pH quality. Now, do you have the QC for the pH meters? Do you do the quality control?
Yes.
Yes. Yes. You do the quality control. It can be done by a technician who's coming from outside, mainly to check the pH meter, to calibrate whether it's working good. And then they will put a sticker when the next calibration has to be, and all those things you have to look for. Okay. And how will you calibrate? You calibrate by putting it in the pH solution that's already been provided by the manufacturer. They will give a pH solution of usually 4, 7, and 10. 4 is to check acidity. The one that we did, I think. We did with a 4 and then with the 7, which is the tap water. And the other one is?
Alkaline.
Alkaline. What is the number?
Base.
10. 10. 10.
10.
10. So 4 to check the acidity. It's provided by the manufacturer. 7 is for the tap water, right? Sometimes they give even the 7, but it's okay. You can check it with the distilled water or tap water. Tap water is fine. And the alkalinity is for 10. So this is the calibration that we do, and we have to record it in a logbook that's been provided to us when we do the calibration. Documentation is part of our job. Always we have to document. So follow manufacturer's instruction for use and storage. When it is battery operated, make sure you take out the batteries from the pH meter, because it will become, yes, it become old, or it won't function again the next time when you perform. Yes, Asinat?
What did you say 4 was for? Sorry.
What?
What did you say 4 was? I know you said 7 was for the tap water.
Tap water. 4 is for acidity that the manufacturers give the 4, acidic level 4. Yes, to check, to calibrate.
4 is calibrate?
To calibration for acidity is pH 4 solution.
Okay, thanks.
It'll be written pH 4. And for alkalinity, what is the number?
10.
10. Very good. It's 10. So we have that in the lab. When you start with the lab math, you'll be doing this individually and you'll be recording it. And when you're putting the electrodes, make sure before dipping it in from one solution to the other solution, you have to put it in the distilled water, and then you have to wipe it, and then you have to put it in the another solution, the solution that you're going to check for the pH. Make sure you shouldn't damage the glass bulb, because that's the one that's going to pick up the electrical potential, that's going to bring the difference in the electrical potential. It has to be measured properly in a solution so you don't break that. Be careful. Electrodes are stored wet in an electrode storage solution, not water, and must not be allowed to dry out. This is for some pH meters where there is an instructions that the electrodes shouldn't be dried, then it shouldn't be dried. But the one that we have in the lab, we have to completely dry and pack it. Clear? So before using the pH meter, look for the manual, look for the instructions, and you follow the instructions. I can go to a new lab and tell, you know what, I don't know about this pH meter. We have only the dry one, the dried electrode ones. That is not the quality of a technician. The quality of the technician should be towards learning, acquiring more information, getting the knowledge. So you have to learn wherever you're going based on the standard operating procedures. You are going to learn. That's your job. That's called acquiring knowledge. According to MLPA, according to the CSMLS, they want you to update the knowledge. You should know about what you're doing, okay? Electrodes are rinsed in distilled or reagent grade water, which means the pure water between test solutions. We did this in the lab. We are continuing to do this in the lab. So when you start with the lab method, you'll be doing this with the lab math, definitely. Electrodes must be calibrated with each use using the solutions of different pH values. I talked about it, pH 4, pH 7, pH 10. Electrodes are immersed in calibrators and pH meters set to read those values, which means the solution that's been provided to you should be measured. After dipping the electrode in the distilled water, wipe it, and then again you calibrate it to find if it is the pH 4 solution, it should be what?
Acid.
Acid. If it pH 7 solution, it should be neutral. If it's the pH 10 solution,
it's alkaline.
Alkaline. But my question is, can you dip it in 4 and directly dip it in 10?
No.
No.
What will happen?
It will change the
erroneous
reaction.
result.
It will change the
not be
electrical
accurate.
charges. Remember, the
Yes.
charges will shift, so it will
Yeah, the
elevate it to
result.
more of something different, right? So the number
Yeah.
will different.
Will change.
So now
yeah.
when you check the pH meter display, then it will show another reading. So now you will tell, okay, this pH meter is no good because the value is not accurate, right? So you're going to confuse everyone. So we don't want those type of confusions. Clear?
Yeah.
Any questions?
Yes.
Any questions? No questions?
No question.
So go through this information. Tomorrow we have to deal with the refrigerators, fridge, water bath, and everything. So you will be going today early release because of the meeting that we have. So go through the information and please come tomorrow with the information. I'm going to ask so many questions. If you have any doubt, you can ask tomorrow in the class. Okay? So for now, that's what we learned. We learned a lot actually, right?
Yes.
Miss, as long as you don't ask any questions about the formula, the pH formula for now.
For now, I'm not going to ask, but you should know what an acid level is, 0 to which number, and alkaline level 0 to which number. So that comes by practice.
True,
Of
Christian.
course, you're going to
Yes.
practice in lab math in a detailed way, but you will get it. It's so easy.
Okay.
Today, you just saw so many numbers, so you're so scared.
Yes.
Because,
very.
yeah, very scared. See? So until tomorrow, come prepared. I'll be asking more questions. We are going to talk about the test questions, which one is important and how you have to prepare all those things. I'm going to tell you. And have a good day.
You too.
Thank you.
I hope you
You
enjoy.
too.
Okay, come up
Thank
with
you.
more
Have
a good
questions.
day.
Questions will make us learn a lot.
Yeah.
Right?
Thank you, ma'am.
Okay. See
Thank
you.
you.
Thank you.
See you. Yes.
See you
Okay, bye,
tomorrow.
guys.
See you
See you
tomorrow. Bye,
tomorrow.
everyone.
Bye, everyone.
Thank you.
Bye-bye.
Bye.
Have a nice day. Bye.
You too. Bye.